y'all can do better than that. Good morning. All right. I apologize for running just a little bit behind this morning. We was given a little bit of time for some people to show up. And she just showed up. No. Good morning, Captain Hurd. I'd like to welcome you to the 988 Tribal Mental Health Lifeline Summit. Wow, what an honor to be here in Southwest Oklahoma and have everybody here present, federal, state, local, tribal people. We've got a full day ahead. My name is Don Ramos with the Wichita and Affiliated Tribes. I am Comanche, descendant, tribal enrolled member, but I'm employed with the Wichita and Affiliated Tribes, project director over the 988 Tribal Response Grant, which is funded by SAMHSA. I am going to introduce our MC, our keynote, comedian, all-around person for the day, and then he's going to take it from there and have our opening song, and then our opening prayer by Mr. McAdams, and then our opening remarks, and move on through the day. I just want to say welcome to everybody that is here. I hope you enjoy what we have in store for you today, and gain a lot of information on how 988 could be a benefit to you, to our communities, and to your families, and everybody. So, again, welcome. And I'd like to introduce Casey Nicholson.
Hello. Hey, there they are. Yee! What's up, everybody? Can we say good morning on the count of three? Good morning. 1, 2, 3. Yes, it is a good morning, and I'm thankful to be here today. Honored to be your MC, your comedian, your keynote speaker, and your MC again tonight for the Gordon dance. So I'm really honored to be here tonight. And what is such a great event, very important event as well. We know, and I've been affected by, we've all been affected some way, somehow, by the things that go on with what 988 really trying to reach out to and do in our mental health. And a really quick story before we really get started. But we really set our intentions for today, and I'm all about setting intentions. And setting your intentions is really important, especially when you get up. And we talk about mental health, we talk about suicide prevention, we talk about a lot of these things, but we often forget because we are in our own world about what some of our people, our family, certain people around the world are going through when they first wake up. Their intentions are not to live today. Their intentions are not to think positive today. So when we often think about those people, we have to reverse the way we think when we get up, like, oh, gotta go to work. Oh, geez, gotta go to the 988 conference, No. What we're gonna do really for today is we're gonna open up our hearts, we're gonna open up our minds, we're gonna open up our abilities to think critically and methodically, to help the people that we serve, to help the people in our own families, and to receive what is really intended for us today. Intention is a beautiful thing, I believe. So if I wake up and I'm in this intention of poor me, I don't like the life that I have, well, that's what you're gonna receive. And I want everybody today, right now, to set that intention of I believe, I'm healthy, I'm happy, I'm loved, I'm gonna receive all the positivity that I'm allowed for today. So if you guys say that in your mind, we're gonna, in addition, I want you guys to kind of think that as this beautiful song that's gonna be sung this morning to start us off, because we believe that music, the drum, the voice, are really does set a really good intention. It calms us, allows us to get into a different rhythm of mind. If you even look at scientific studies as well, you'll see that the rhythm of music is very, very healing. So I'm really happy to introduce this individual. He's a good bro of mine. He's good looking. He has a soothing voice. So all you ladies, don't be googly eyeing him. I want you guys to keep your eyes closed and just imagine your husband in your eyes, not him. Hey. Ladies and gentlemen, give a round of applause to Corey Reeder. Yeah. And as he sings, when he starts singing, I want everybody to stand up because this is the Wichita flag song. So, and remove your headgear and stand in honor of our flag songs, our veterans, and our tribe. Oh. Wichita and affiliated tribes to come on up here, and she's going to do her welcoming and acknowledgement. Here's where, oh, there she is, okay. Yeah. Oh, we're going to pray? Oh, we're going to pray first, all right. I just seen that. We're going to pray first. Gary, come on up. This is Gary McAdams. He's the elder of the Wichita and affiliated tribes. He's going to open us up with a beautiful prayer as well, so again, I don't know what he wants us to do. Some people sit, some people stand, and I don't know the customs here in the Wichita area, so I'll ask him. Or he could guide you on that.
Good morning. I'm very honored to be asked to pray for us this morning, play some little part in important
All right. Thank you, Gary, for that beautiful prayer. At this moment now, we will go into our welcoming from our president of the Wichita Affiliated Tribes. Please put a good round of applause for Terry Parton.
Good morning, everyone. Actually, just Terry Parton to Titty Kitty Kitties. That's E. I said, how are you all? My name is Terry Parton. I am Wichita, and I'm president for the Wichita Affiliated Tribes, and I want to welcome you all this morning to the 988 Summit. The Wichita Affiliated Tribes are Aboriginal to Oklahoma, along with the Caddos that were in the southeast, and we just want to welcome you. Also want to thank the Fort Sill Apache Tribe, and I'm going to call their vice chair up here in a few minutes and let her say a few words, but thank you for letting us use this, the casino to hold this summit. In addition to being president, I also co-chair the SAMHSA TTAC. I work on the IHS budget formulation, and I'm a member of the Secretary's Tribal Advisory Committee. And I say that to know that those are spaces where I can advocate for mental health issues and funding and things like that. And it's really important to me. And I just want to share a little story about why our tribe is involved with SAMHSA. When I was young, I had a boyfriend, and he had a brother, and he was always really nice to me and stuff, but I didn't know him that well. There was one Sunday morning that he called me and asked me if I'd bring him down here to Lawton, and I couldn't do it. I had to work that day, and I really didn't know him that well. I worked 2 jobs, one in Anadarko and then one at Southwestern. That Friday, that was on Sunday, and on Friday, my sister called me at Southwestern. I was working at Brahms, and I remember specifically, she told me that he had shot himself. And I just remember dropping the phone, and I came home. And I didn't talk about this for a long time. I had suppressed that memory for a long, long time. And I guess sometimes you feel guilty about things. Like, had I taken him, maybe that wouldn't have happened. Many years later, we would have several tribal funerals out at the Anadarko Cemetery, and I found myself going and visiting his grave. This SAMHSA grant came available, and we had 2 tribal members that had asked if they could help us write it, and it just brought back all those memories. I had been going to visit that grave, and I felt like that was just a calling that we should be applying for that grant. We applied for it. We got it in October, and we had a little bit of trouble getting the grant started, as we always do, but there was a young Wichita girl that worked at our travel plaza across the street, and I would see her every morning, and that at the end of that year, she committed suicide. There was a young boy. He was in our Wichita family. He wasn't enrolled Wichita, but we considered him part of our Wichita family. I would go to his house during Christmas to see his brother that had been in the hospital, and I just remember him opening the door and greeting me when I came in. Right before Christmas, right after the 1st of January, he committed suicide. So I truly believe that for our tribe that was a calling for us to be involved in the SAMHSA grants and to build those programs. Luckily, I've had Don Ramos, and I don't know where he's at right now, but he's back there. We had several people throughout the years, but he has helped grow all of our programs. We now have 8 SAMHSA grants within our tribe, and we service the community of Anadarko. We are in the schools. We don't just help our own people. We help Native people and non-Natives in the community through different avenues. And thank goodness for Anadarko Public Schools and their leadership there that they've allowed us to be inside those schools. Sorry, I don't talk about this all the time and stuff, and so I just want to thank you all for being here, because it is important. It's important that we get these programs out into our communities, not just Native communities, but all communities, because our families are intermarried, and we serve that whole community. And so I just want to thank you all for being here. I do want to recognize Dr. Jonna James. When we first got our RISE program, she was one of our directors for that program. She just got her doctorate, and I just want to congratulate her for helping us get that program started initially. Chelsea Doro is our public health administrator, services administrator, and she's back there. But I would also like for all of the Wichita and affiliated tribes staff that work with any of our SAMHSA programs or mental health programs, I see Levi here, if y'all would stand up for a minute. These are the people that are going into our schools and our communities and helping our kids and our families. I just want to thank them. Once again, I just want to welcome you all, and I would like to call Pam Eagleshield. Where'd she go? Oh, there she is, right there. And let her say a few words on behalf of her tribe. Thank you.
Good morning, everyone. My name is Pamela Eagleshield. I'm the Vice Chairwoman for the Fort Sill Apache Tribe. I wanted to welcome you to our facilities, and I wanted to thank the Wichita Tribe for what they're doing, what they've been doing. Suicide has plagued our community for a while now, and we're losing young people left and right. My son committed suicide 8 years ago, and of course you never recover from that. But I want to thank the Wichita and affiliated tribes because they have spearheaded this effort and this address that was never really looked at before. And it's such a tragedy because it's so many of our young people, so much potential lost. But I know you guys are the frontline warriors. You guys are the ones that do everything you can every day to make sure that doesn't happen. From the bottom of my heart, on behalf of my people and myself, I want to thank you for everything you do every day. I know you guys, a lot of you are underpaid and overworked. I want to thank you for the lives you save. Welcome to our facility. I hope you enjoy yourself. If you need anything, let me know. I'll do what I can to help you. I hope you enjoy your stay. Thank you.
Hey, all right, thank you so much for those beautiful words and beautiful stories, and appreciate everything you do as leaders of our tribes. We know the hard work that you put in, all the time and sacrifice, so we really thank you for coming over here and helping us out with that welcome. Next, we would like to bring up Carrie Slatton Hodges, the Commissioner, Oklahoma Department of Mental Health and Substance Abuse Services. So come on up, Carrie. A round of applause for her. She's making me all nervous.
Thank you. It's such a pleasure to be here today and to be amongst so many friends, but more importantly, so many people who are working towards making this a better place to live and grow and be, hopefully at some point in time, free from mental illness, from trauma and struggles, and substance abuse issues. So I'm blessed and proud to be in a room of people who this is the utmost concern for. You know, several years ago, legislation was passed on a federal level that said, for the first time in the history of the United States, we would have a 3-digit number specifically for persons that are needing to reach out with mental health and addiction issues. It's pretty phenomenal that on a federal level it was finally recognized that this issue is as important as any other issue in our nation. And so in doing so, in creating this 3-digit number, so that persons don't have to call on law enforcement when they are struggling with mental health issues, that they can call and reach a mental health professional who can understand what they're going through, who can make sure that they are linked with support and service, that there is someone to talk to around our state is so incredible and so important. And when at the Department of Mental Health and Substance Abuse Services, we realized that this could be a real catalyst in our state to grow and build a system that supported anybody in need that was reaching out for care. And one of the things that we know is that people who are engaged within our systems, your systems, who have already reached out, are much less likely to die by suicide. But there are so many folks here that have never reached out, and they don't know where to reach out. And so by having this easy 3-digit number for people to remember and know when they are having thoughts that could push them in direction of not being here anymore, and all they have to remember is those 3 digits, we have an opportunity to save lives every single day. And I am so grateful to SAMHSA for having recognized the importance of this and having pushed for this to be a part of our fabric, to understand that this is what we have all been waiting for people to have a means to reach out so that we could build up a system to support folks who are reaching out. I'm going to get this wrong. It'll be my version. But what SAMHSA says is that what is important is to have a place to call, someone to talk to, and then a place to go. So if you are in need, what we are all working to build together is now we have a place to call, and we have someone to talk to, and we have to make sure that we have the resources, whether it be outpatient services, inpatient services, mobile crisis teams, laced all across our great state so that folks have the ability to have the resources at their fingertips whenever they are needed. The stories this morning just really touched my heart about family members lost. I too have lost family to suicide, and what I wouldn't give to have had them reach out in any way, shape, or form so that we or myself or anybody could have been there to say, this will pass, and we are here for you to see you through this until the feelings that you have today pass so that you can move on with your life and make such a great difference. It's just so wonderful to be here amongst friends. We meet regularly as a group with the behavioral health folks across many tribes. And one of the things that I have to say is that persons who work in behavioral health are a very special group of people who are so caring and so dedicated and any kinds of created or perceived divides to make sure that each and every one of us is lifted up. And so I'm so grateful and so thankful for the partnerships that all of you have been a part of. And again, I am so thankful to be here today. I think I turn it back over to the MC, or should I introduce the next? I could introduce the person that I think is next, but I might get it wrong. Okay. So next I'd like to bring up Ms. Monica Johnson, who is the Director of the 988 and Behavioral Health Crisis Coordinating Office with the Substance Abuse and Mental Health Services Administration. So come on up and welcome, Monica.
Good morning, y'all. I do say y'all. I'm gonna say it here too. So I have some written remarks, and I'm gonna make sure I say those, but I cannot start without acknowledging the stories that were shared this morning. I have goosebumps and chills. Those stories help remind us of our why. It helped me personally be reminded and grounded in why we get up and do the work that we do every day. I say collective we, because there's many of us working to not only push the efforts of 988 forward and the promise that it brings and the catalyst that it is to help us be better as a nation, to be able to be responsive to every single person. Every single person. Does not matter your ethnicity, does not matter your sexual orientation, does not matter your gender, does not matter your race, does not matter who you are. You will be impacted in some way with mental health, substance misuse, or you will know someone who has been impacted. If there's any question about that, just remember pre-pandemic, post-pandemic. People who thought before, mental health, that's about other people. That's about somebody that's not me. Suicide, that's what happens to other people. Substance misuse, that's people who don't know how to control their behaviors. Now, no one can say that you have not been impacted in some way. And so that grounds me, and I hope it grounds you all, and it helps you remember your why and why you're in this room. I remember being at a crossroad when I was about maybe 20, 21. I won't tell you how old I am, but I'm not close to 20 or 21 anymore. And I was trying to figure out, what did I want to do? Did I want to go into this field? Did I want to go and study psychology? That was kind of where I was. Or do I want to be a lawyer? And so I was working 2 jobs trying to decide. One was with a lawyer, and one was with in a residential psychiatric treatment facility for children. I obviously chose the latter, but it's been a long time. It's been over 26 years since I made that choice. And today and this morning, hearing from the leaders, you reminded me of why that choice was needed. And so just thank you. I feel honored and so privileged to be here amongst you. So now I got to say what they wrote for me to say. So I do want to just say thank you again. Good morning, obviously. I look so forward to the next 2 days, today and tomorrow, to be able to do this. I'm obviously from SAMHSA, which is a federal agency, but this is the work that matters most to me, that is most meaningful, is when I get to come outside and be outside, and get to be with people and get to hear your stories, get to hear what is it that we can do better to help support you, your families, where you are, and what do we need to know that we can do more of? And so we'll be here today. I'll be in listening mode. I get an opportunity to come back later today and talk more about the work we're doing related to 988. I do want to say I had an opportunity to meet a couple of folks this morning, and I can just see it from looking around. The connections that will happen today and tomorrow are going to be key to making sure that the work that you're already doing will help us move together better in this behavioral health care crisis space. I want to thank President Terry Martin, who I had an opportunity to speak to this morning, from the Wichita affiliated tribes and the larger Oklahoma tribal community, the Oklahoma Department of Mental Health and Substance Abuse Services, as well as the behavioral health organizations that are represented today to make this summit possible, and those that work every day to improve mental health services, behavioral health services as a whole, here in Oklahoma and nationwide. This is my first time in Oklahoma, and I'm having a ball so far, so thank you for the welcome. I'm sure you don't hear this enough, so I'm gonna say it every time I get an opportunity. Just thank you, thank you, thank you for everything that you're doing. Throughout the summit, you'll hear us speak about partnerships, you'll hear us talk about collaborations. You've already heard some of that, and you've seen that from the speakers that already have spoken today. That is going to be critical to continue to move this work forward. This is the biggest group project that you're gonna ever be a part of. We'll continue to talk about the importance of collaboration between federal and state entities, tribal nations, community health providers, service organizations, and many, many others. One long-standing relationship of note is one we are here celebrating and acknowledging today. It is the one between state agencies and tribal nations in Oklahoma working to improve behavioral health services. We also see this collaboration between SAMHSA's Office of Tribal Affairs, or OTAP as we like to say, Carrie wave at us, and tribal nations in the state of Oklahoma. OTAP serves as SAMHSA's primary point of contact for tribal governments, tribal organizations, and other government and organizations on behavioral health issues faced by Native people. SAMHSA is committed to the continuous improvement of our relationship with tribal nations through joint consultation, outreach, education, and engagement efforts, just like what you see happening right now. I'd also like to give a shout out to the innovative communications work being done in Oklahoma. We see and appreciate your creative Twitter posts, your 988 branded license plates, your 988 branded school resources for children, your activity sheets and posters, and I think I got a t-shirt that I'm taking with me. These are just a few examples of state and tribal organizations working together to spread the word across social and traditional media about what 988 is, suicide prevention, and crisis care services, and why this matters for every single person. Your branding may slightly differ from the national branding, but we share a common vision and message, which we applaud, that everyone in crisis should have someone to talk to, someone to respond, and a safe place to help. And I will go a step further because I just can't not say you don't have to wait until you are experiencing a crisis, which has no one definition. It is, what it feels like for you, right? So you don't have to wait until you're in a crisis to reach out to say, I think I need some support, and I think I just need somebody to talk to. Don't wait until you feel like it's an emergency room. We don't do that for physical health. If we feel like, is my arm going numb? Is that a heart attack? If we feel like our blood pressure is elevated, if you feel like, whatever, your glucose levels are elevated, whatever it may be, we don't tell people with those experiences to wait till you feel like you got to go to the emergency room to seek out help and support. We treat behavioral health different, and we're gonna be a part of the fabric, all of us, in changing that approach in that conversation. Before I joined SAMHSA, I had an opportunity to spend many, many years. I've worked in this field for 26 years at this point. I worked in behavioral health at the state level for 12 years in the state of Georgia. I most notably was the division director for behavioral health. In the first 6 months of the rollout of 988, I got to do that at the state level and understand what it means to transform communities, one community at a time within a state. And I left the department as the interim commissioner. So I understand what collaboration means. It's an action verb. It's not something we just do by showing up today. It's what we do today, but what we do beyond today, what we do tomorrow, what we do next week, and what we do a year from now. That is where the magic happens. Truly transforming the way we do crisis care in this country will require everybody's voice. It will require the voice of individuals with lived experience. It will require the voice of policymakers. It will require the voice of paraprofessionals, psychologists, psychiatrists, teachers, families, religious leaders. It is all of us. But too often, what we promise and what we say to one another is that we'll have a partnership, those that will result in organizations being far removed from the communities that they serve, telling community members instead what services they should receive rather than listening to understanding what they need. So our commitment is to try to stay as engaged, try to be in the communities. That's my commitment as long as I'm in the role, to make sure that we don't lose sight of what the realities are of what happens on the community. I was so thrilled when I heard the references made this morning of the number of grants that have been disseminated, but I also sit with and understand the challenges that it is to sometimes apply for those grants and how we can make those processes be better, and we continue to work on that every day. But I won't know those things if I'm not doing like what I'm doing today. So if you see me walking around, I'm in red, I'm bright, I stand out on purpose. I don't want to blend in today. I want you to be able to find me and tell me the things that you wish I could take back with me. That is what true partnership and collaboration looks like. That's what it looks like when it's an action, verb, and not just a word we say as a noun. We've seen positive results from forming diverse partnerships to address health and equity. We have licensed 988 Lifeline access across several at-risk populations. In our first year of 988's Lifeline, we've added Spanish language text and chat services, LGBTQI+ services for youth and young adults under age 25 and under, and American Sign Language services for those that are deaf or hard of hearing, and ASL is their preferred mode of communication. As we look back on our first year, the anniversary of 988, we do celebrate its successes. But it's essential to acknowledge the importance of providing comprehensive crisis care that will continue to cater to all the diverse needs that represent this country. Looking forward, SAMHSA continues to increase support for at-risk populations. This including specialized services for American Indians and Alaska Natives. We're working with our partners to continuously improve connections with 988 crisis contact centers. We need to do things such as addressing workforce challenges, which continue to plague our industry, and increase culturally sensitive resources for anybody experiencing a crisis. We're working to continue to increase access to and increase behavioral health funding and decrease the stigma attached to mental health and substance use issues, and increase the quality of behavioral health services available to tribal members. The conversation we're having today takes us, I think, many, many steps beyond stigma. I think, again, as I referenced earlier, that prior to the pandemic, people would say, that's not about me. You're talking about mental illness, you're talking about this or that. Those are the people over there that look like this, before realizing we all have had some feelings about something and needed some emotional support. So, as I begin to wrap up, I just want to make a few final thoughts. Since we're gathered here today to collectively share ideas and discuss possible solutions, I wanted to draw attention to innovative partnerships in the state of Washington, which has enabled those living in Washington to dial 988 and press 4 to be connected to the Native and Strong Lifeline. That was a huge accomplishment. This is the first program of its kind dedicated to serving American Indian and Alaska Native people with an emphasis on cultural and traditional practices. And it is a powerful example of what is possible when we think outside of the box. During the first year, along with expanding 988 services to better serve at-risk populations, we also saw success with shorter wait times, fewer answer rates, and increased funding, again, to bolster the network and hire more trained counselors. Developing these services would not be possible without the knowledge, the dedication, and collaboration of community members and mental health advocates and professionals just like each of you. As you attend the summit today and tomorrow, I hope you will keep in mind the importance of your voice and your contributions to this life-saving work. I meant what I said. If you see me, you want to put something in my ear, please do so. I am here to listen, to learn, to be engaged, and to be connected. Thank you so much for welcoming me to your great state of Oklahoma. And with that, I don't know who's next, so you're going to have to come back up here. All right. Thank you all so much.
Check, check. Right on. Great information. Thank you so much. You have a beautiful day. Right on. All right, now I feel so contained here, you know. I'm just like, I'm like a caged animal right here. So I had them go get a cordless mic because I'm more of the walker around kind of person. So our next update, we're going to have an update by the Tribal Partnership and Collaboration of the 988 Grant. I would like to have a big round of applause for Jennifer McLaughlin. She is from Osage Nation Counseling Center, and she's going to give us an update. So I wish we just had like some cool music, hey? Yeah, for the walk, for the long walk here. Right on. All right, thank you. You can use either one. Okay.
Good morning, friends. As I was sitting here listening this morning, I was reflecting on my own history. And I have a lifelong battle with depression. And back in my 20s, which was a long time ago, I was sitting here thinking how much the 988 number would have benefited me. I wish that it had been here, and I'm so happy that we have it at this time. In December of 2022, all across the United States, people were awarded the Tribal 988 grant. And here in Oklahoma, we had a whole mess of grantees. And I know myself personally, I was ecstatic to have it. I was humbled by the amount of work that it required, but I was also a little overwhelmed because how do we begin to make a difference in this community of ours, and how do we make a difference across the state? In February, we had our first meeting with our grant officer, Susan, and Susan was so encouraging. She gave us hope to get started, but it was still so much work. And in March, we had our first meeting of the Oklahoma tribal grantees. And from that was an amazing thing. I can't even begin to describe it. We came together as a community. We realized that together there is so much that we can accomplish, and together we can make a difference in Indian country. I have never experienced the type of camaraderie, support, and friendship that I have with this Tribal 988 grant. And it is our hope today that across Indian country, we'll gather some more grantees, we'll gather some more tribes who maybe don't have the grant, but want to make a difference in their community. And we will continue to make a difference because together we can impact our brothers and sisters, our aunts and uncles, our friends, our parents. Together we stand strong. And this is an instance today where we want to try and figure out not what went wrong, but what went right. We stumbled onto an amazing formula in working together. And I think that is the history of Indian country. When we stand together, we can overcome anything. And so I encourage you today to think about how you can carry 988 into your communities, how you can work with us. If you would like to join our 988 group, please contact me. I'll be around for the next couple days, and we would love to have you join our community. Thank you so much.
Thank you so much, Jennifer. Right on. All right, we're going to be going right into our next update. It is my 988 story, not my, but that's the title of this update. I'd like to a big round of applause and a welcoming to Zachary Black Owl. Zachary Black Owl. We're going to come on up. He's a community outreach specialist from the Cheyenne and Arapaho. And we're just going to, wish him well up these stairs. Yeah, there you go. All right. I should save the applause until they walk up the stairs, hey? All right, Zachary. You can use this or you can use that.
Okay. Good morning. So, I was asked today to share my 988 story from, like Jennifer said, all the partners that we gained throughout our grant. And when they asked me that, I kind of thought about it for a minute. I was like, wait, how many people are going to be at this event? Who's all going to be there? And throughout the planning of this, it kind of just snowballed to something bigger and bigger and bigger. And I realized that I need to share my story. If we're going to heal the people in our communities, if we're going to help the people in our communities, we need to put these stories out there. So over the past couple weeks, I've been trying to come up with a story about my 988 story and how I called 988 last year after being overwhelmed with grief from missing my mother, who I lost in January 2022 to cancer. So just bear with me. Okay, here we go. Once upon a time, there was a young man who thought he had it all figured out. He knew what career he wanted. He knew what year he was going to graduate college. He had all the support and love from his family and friends. And he was working for his tribe in a role that no other tribe member his age was working in. This young man was the baby of his two siblings and always considered himself to be the favorite. While all his friends were raising kids, getting married, and buying houses, he decided to focus on his career, his education, and traveling before he could even consider any of those things. Now, while this young man made time for his social life, school, and work, there was one person you could always find him with, and that was his best friend, his role model, his everything, his mother. After everything accomplished in his life, his mother was there supporting him. After every breakup and heartache, his mother was there to comfort him. And after every time he fell down or failed at something, his mother was there to pick him up. He loved his mother so much that he could never imagine life without her. As the years went on, so did their relationship. They did everything together, from going to Fleetwood Mac concert and singing Dreams Out Loud, to going to the Fair of the Heart to try all the free samples, and to yelling boomer at Texas fans at the Cotton Bowl as OU wins again. He truly loved his mother to pieces and did not care if anybody thought if he was a mama's boy. Then the unthinkable happens. One day, this young man's mother realizes that something is wrong with her body, and she wanted to find out what was going on. Just like her, he was there to support her and be with her as they went to the doctor's offices to find out. After months of tests and visits, his mother was diagnosed with stage 4 colorectal cancer. And instead of getting upset and crying, this young man stayed strong for his mother and continued to be optimistic about her treatment plan and odds to beat this disease. He quits his job so he could take care of her 24/7. He spends every day with her, takes her to her appointments, cooks and makes her food, watches her favorite movies and TV shows with her, and he was even able to cook a whole Christmas dinner with the family, with the guidance of his mother, of course. And she made sure he cooked everything right by having him bring in all the dishes one by one to her bedroom, making sure everything was cooked correctly. So needless to say that he knows how to score a ham correctly. He spends Christmas Eve and Christmas Day with his mother in the hospital as she undergoes chemotherapy treatment. New Year's comes, and he's at home celebrating with his sister and his mom, even though his mom is asleep as the ball drops on TV. He takes her to her bed with her favorite blanket wrapped around her, and as he lays her down and gets her tucked in, his mom wraps her arms around him and tells him, "I love you so much, son." He didn't know this would be the last time he would hear his mom say that to him. His mother's cancer had spread throughout her body. He watched her go through so much pain and grief since she was diagnosed. He wished that he could take it all away from her. He was never used to seeing his mother like that. And life decides to add more to this chaos. His mother tests positive for COVID-19 during a visit to the ER. One day passes while his mom is in the hospital with COVID-19. He calls his mom's cell phone to check in on her before she goes to bed, because due to COVID-19 guidelines at the hospital, they cannot be together. And not long after he called her, he receives another phone call from the hospital. He finds out his mother has started her journey into the spirit world. And he remains in denial until he arrives to the hospital, where he wept and wailed for his mother, his best friend, his everything. Now here is that same young man with all that ambition, support, goals, and love that we heard at the beginning of the story. This same young man has now planned a funeral for his mother at 27 years old. He's gone through a traumatic event. He's suffering with depression from losing his mother so fast, and he is now getting anxious because he does not know how to properly process that kind of grief. He's unemployed, overweight, unhappy, and does not know where to even begin to pick up the pieces to his life. He goes through this cycle for over 6 months into 2022. He tried different methods and mechanisms that he had learned over the years, but nothing seemed to work. He went on trips with his friends, reached out to his support system, and he even rescued a 6-month-old Great Pyrenees puppy from an animal shelter, who he now calls Roscoe. Now, while these methods worked for a little bit of time, he was still experiencing depression and was still finding himself crying himself to sleep at times. July 3rd. July 3rd is his mother's birthday, and this is really when everything overwhelmed him. This is a special day to him because he would always do something for his mom's birthday, whether it was a day trip to Dallas or an evening out to her favorite Mexican restaurant. This year, he didn't do anything for her birthday. He tried to go out and be with friends for the 4th of July holiday, but when he got home that night, it was the same thing again. He called into work that next day because he was so overwhelmed with grief and sadness. He did not leave his room for over 24 hours, and he sat there with his new best friend Roscoe, who was telling him everything is going to be okay, as he tried to comfort him by laying with him and licking his tears away while he was crying for his mom. He prayed and prayed for help from God for days, and he knew crying and being sad for this long was not normal, and he didn't know where to go or who to go to. That is when he saw an ad on TV as he was playing snippets from podcasts about grief. He saw an ad for a new free 24/7 mental health resource. He saw the 3 numbers, 988. He picked up the phone, dialed 988, and after about 30 minutes of talking to the agent on the line about everything that had happened to him this whole year, and while he called, he was finally ready to ask for help. And it was so hard for him to ask because he never knew how to ask for help when it came to his mental health. He was guided through his emotions. He was asked if he had thought about suicide or if he had a plan to suicide, and thankfully he said no. But he did acknowledge that he did question his existence and he wanted to be with his mother again. The calm voice on the phone walked him through his mental health crisis, and he was able to get referred to a local mental health facility where he was able to be treated for depression and anxiety. And he also received information on grief and loss. He continues to practice what he learned from this visit to from the mental health facility, and he is in regular therapy sessions, and he continues to learn more about his mental health as time goes on, because it is an ever ongoing battle when it comes to mental illnesses. He now works as a community outreach specialist for his tribe's 988 Tribal Response Program. He is back in school. He moved back into the home where his mother raised him, and he wants everyone to know about 988 and the mental health resources that are available to them. In addition to this, he is working for the same program that his mother used to work for when she was with the Shinnecock Tribe's Department of Health, and he couldn't be happier with the path that has been chosen for him. He's learning his language and culture as days pass, and he loves working with his team, who have been so supportive and loving, as he continues to figure out life without his mother. And he also finally convinced his sister to move back to Oklahoma with him from Pennsylvania, and he couldn't be more happy to be close with her again. Now, the young man in this story was me. And I truly believe that if I did not call 988 when I did, I would not be here standing today with you all to be able to share my story. So if you ever lost a loved one, experienced a traumatic event, or you just need someone to talk to, 988 is there for you. 988 was there for me, and that's what I want to share with the world. That is what I preach to our communities, and that was I want to share with the people who are suffering from the same situations I went through. I know my story is not the only story out there. There are thousands of people in our communities who are suffering because they think there is no help. It is up to each and every one of us in this room to make sure our people do not suffer in silence and take their life. We are the ones who know our people. We shouldn't wait for someone else to step up. And before I leave you today, our 988 program at CNA Tribes, we have 3 sayings that we share with our youth and our people. And I want to share that with you today. So if you will, repeat after me. You matter. There's hope. And we're here to help. Ha-ho, thank you for your time.
All right. Thank you, Zachary, for that story, your update story, the moving story, the beautiful healing story. And like he said, I think a lot of us know either people that went through it or even ourselves might have went through it. And some of us can relate to that particular story. It is very heartfelt. It is real in our communities, in our nation, even as close as to in our families and even as close into our own hearts. And I often think about stories like that, when I go do emceeing or I go do motivational talks or inspirational talks or whatever it may be around the country, knowing that there's somebody out there in that crowd. And even when I do comedy, realizing, there's somebody that comes in, and I think sometimes I realize that when I do comedy, there'll be that one person that comes in and their head is down, they're just not in it, they're just there to be there, And I'm thinking in my mind as I'm scanning the crowd, I wonder what they're going through. I wonder what troubles that are, what they're going through right there in that moment. And I wonder how power of a story, my story, because I do a lot of my stories through comedy, but it's a trauma story. I wonder how healing to hear somebody else's words, like when I do it on comedy, but to hear how healing that can be for the next person trying to get through their day. And we often talk about, us as frontline workers, they're every day, 8 to 5, or even sometimes longer, how those warriors that are out there fighting the good fight. But I also think about people, like this young man, about how his fight is and how every day what goes through his mind, and he's just fighting just to make it through that day, just to wake up that day, just to get some type of motivation and inspiration to make it through that hour. Each moment, each second is blessing. And sometimes, if we don't feel like we contribute, we belong, life is too hard, we don't feel like we could go on another hour, another second, or another minute, or another day. It doesn't matter. And so that's why I always set the intention at every conference I go to, every motivational I talk to, I try to set that intention, that positive vibe, to say, you are worth it, you are loving, you are beautiful, you are great, because you are. You belong, you're not alone. We all go through some type of mental health waves, and I'm really moved by your story, and I'm really inspired by your story as well, and I hope I can share your story. I won't use your name, or maybe I can. I'll ask you for permission as I go around the country talking to different schools as well. I talk about school to suicidal ideation. I worked in behavioral health. I got my master's in mental health counseling, and I did all that stuff, but somewhere around that time, I was tired of the 8 to 5 job, okay? I was tired of it. I was like, no more. Tired of this, I got to go do something else. And I got a master's in mental health, and I was like, well, what am I going to use it for? And I said, well, I'm going to become a comedian. But as I realized, through comedy, there's healing there, and then through healing, and then I became a motivational speaker at the same time, and I realized I'm still using my mental health degree, but just in a different form, in a different way. And hearing stories like that just adds to the arsenal that I can share that good medicine. I can share that with around the country to other reservations, urban and rural areas, to our native kids, to our urban kids, to kids all over, to adults, to elders that might be going through the same thing. So again, big round of applause to Zach again for sharing his beautiful story. Yes. Very, very courageous. I really appreciate it. So now I know some of you guys are just like ready for that break. You know, you guys are ready for that break. Okay? I want everybody to stand up, okay? Because sometimes the things that we talk about in certain times of conferences, it kind of just sits there, you know? It kind of gets kind of leveled out on the bottom. So we're going to move that energy, okay? We want to move that energy around before we go to our break. And when we go to our break, we're going to, take a deep breath. We're going to laugh. We're going to mingle. We're going to do whatever I do to move that energy around. We're not going to just allow it to sit there. We're not going to allow it just kind of, be stagnant. We want to move that energy around because that's what we are. We're energetic human beings, okay? So first and foremost, I want you guys to kind of wiggle your fingers out there. Wiggle them like spirit. Is that what they call spirit fingers? I don't know. Is that what it's called? Yeah, okay. Move them, right? And I want, as you're moving your fingers, I want to go up to it. Reach high. Okay, reach high. And now, I know some of you guys are going to be embarrassed, but that's okay, okay? Everybody close your eyes. Trust me, okay? But do not fall over, okay? As you are doing spirit fingers, I want you to go in front of you in spirit fingers and try your best to touch your toes. And the reason why I had you close your eyes is because there's people in front of you, okay? I want you to bring your spirit fingers back up. You're not done, okay? And I just want you to go side to side as your spirit fingers are going, okay? And as you're doing this, now I want you to wiggle your toes. Some of you guys are going to learn coordination here, all right? Coordination, okay? Okay, stop, all right? Now I just want you to kind of just move your legs just a little bit, move your legs, okay? We want to move that blood. We're sitting. How many guys got tight hip flexors, These things right here are just tight, right? They're just really tight, right? That's what I'm doing right now. I'm loosening up those tight hip flexors, right? Okay, you're going to come back up again, okay? And now, this is what I want you to say. What were those 3 things you said? Okay? Or I matter? Okay, ready? We're gonna shout it because when we first did it, it was like, you matter. We're going to say it like we mean it, right? Okay, you matter on the count of 3. 1, 2, 3. There's hope. We're here to help. And round of applause for yourselves for being here. Woo! Right on. I love it. We will do a break. We'll come back at 10:15. Also, remember, try to come back on time for the respect of our other speakers. We don't want everybody coming in, filtering in while they're speaking. So please respect the time. 10:15, come back. Go get your coffee, move around, visit, make connections. And we'll see you again at 10:15 on time. have any friends out there, ask them to come back in. We're starting. Hurry up. Please. Have them come back in, and we'll continue with our agenda here. All right. So again, thank you. Welcome back. Hope you guys got some coffee, got some good conversations. You're making good connections with each other and building up your resource and your tools. And that's what it's about. Especially that's what I like about conferences. You really get to meet a lot of cool people that are in the same field that you maybe never even met before. And so it's really good that, get out there, mingle, make connections, and build some awesome relationships that will not only benefit you in terms of friendships, but also benefit maybe your tribe or your programs as well. We have another update that we're going to be coming to you. This is the kind of more or less coming up from the crisis of Continuum of Care. I want everybody to put their hands together for Tony Stelter. Come on up, Tony. All right, Tony's cool shoes, right on. I like it, Tony. He's the Director, Contact Center for Operations and Clinical Services. And I don't know how to say that one. Is it Solari or Solari? Solari. All right, another big round of applause for Tony.
Yeah, I think it's all.
Okay. Tony, sorry, and also this will be kind of a more or less like a panel kind of thing. Ronald Sims as well. Ronald, where are you at? There you are. Holy, can't miss him. And also Joshua DeBartolo. Is that right? DeBartolo. Yeah, Joshua. I met him earlier. Yeah, great guy. All right, and I'm understanding that you guys are probably. I got another mic down there. If you guys want to just pass the mic or share mics. Okay, I'll bring it up to y'all. Yeah.
All right, testing. All right. Hi, everyone. My name is Ron Sims. I'm the Chief of Statewide Crisis Services for the Department of Mental Health and Substance Abuse. And I'm super excited to be here today with Tony Stelter, the Director of our 988 Contracted Call Center, Solari, and Josh DeBartello, who is our ODMH SAS Tribal Liaison and has been working so diligently with all the tribes across the state and helping organize our 988 response. So we're going to hopefully talk about services available and how we are engaging with the tribes and just all out through the state. So with that, I'm going to hand it over to Tony to talk a little bit about 988 services and how that works in Oklahoma.
Can you all hear us okay? Okay. I'm still thinking about Zach's story, and that hearing that just sometimes, working. My name's Tony, by the way. I work for Solari, and we have the contract in Oklahoma to do the 988 contact center. So when folks are reaching out to 988, we're who they talk to first. And then we're just one piece of the big continuum, the big puzzle, the community of crisis that serves people. But hearing Zach's story, sometimes I'll get caught up, in the day-to-day of like the job and the stress and, like the staff stuff and like the politics or whatever it is. But when you hear stuff like that, it really reminds you what you're doing and why you're doing it. And so thank you so much, Zach, for sharing that story. I just really, really, really like that. So yes, I work for Solari. We're actually a company that was originally from Arizona. That's our headquarters. They've been doing crisis work for 15 years, I think, and they've been doing it very well for a long time. So they're kind of an OG in the game of crisis care. And so I used to work with the department with Ron in crisis services for a long time, and not in crisis services and a range of different things. But I got to come over and join, and I wanted to be a part of something that like 988 that we're doing. And so joined the company of Solari, who has the contract with the department, and we've been getting to do some really great work for this past year, over a year now. I think we have answered, how many calls do you remember? Way over, I think we're hitting close to like 50,000, 60,000 now. Answering calls. We started doing chat and text for Oklahoma this July 3rd of this year, and that's been going really well. But I think we're going to take some time too to answer some questions that y'all have, and any questions y'all have, we'll answer. So I'll let Josh too share.
All right. So my name is Josh DiBartolo. I'm originally from Lawton, Oklahoma. I was born and raised here. This is home for me. Born in Lawton Indian Hospital, like many of you guys may be. So like Ron was saying, I am my new title is the Senior Manager of Community Integration. What does that mean? I'm still figuring that out. But I do work with our tribal nations and different things like that. But one of the things I wanted to talk about today was, we're here having a conversation about collaboration. We're having a conversation about 988 here in Oklahoma. But one of the cool things that we get to talk about is how Oklahoma has been uniquely different and how we've been collaborating here in Oklahoma. So that's been something that's really unique that I've seen in our state. I heard Washington mentioned earlier, which loved the Native Strong Lifeline in Washington, Raquel, and what they're doing up there. But in Oklahoma, we're doing it a little bit different, and we're coming together every month and having meetings where we're talking about 988. We're having conversations about what's happening in our communities. So what does that mean when we're having these conversations about what's happening in our communities? We're basically having the conversation of, one, what's our marketing approach to getting 988 out in the community? One. Two, what events are we having? And how are we focusing specifically on getting people connected to the resources? Like Zach's story today of how he found 988 from listening to a podcast, essentially, right, Zach? Of having those different ways that we're saturating markets and getting people engaged with the different aspects that we have. So it's just about how we're targeting. So some of the stuff that you'll see out here, we have our 988 messaging that we've done with our tribal communities. So one of the things that we did for the very first year, our saying for the poster that went around town. Blake, your guys' billboard still up here in town? Where's Blake at? I always call him Blake. There she is. Blake, is it still up or no? All right, it's still up. Just go down Cash Road, right? I forget what this road is. Cash Road, right? Gore, okay, Gore. I haven't lived here for a while. So go down Gore. There's a billboard that says, I don't remember exactly what it says. It says, Blake, what does it say? Hit me with it. Our traditions stay alive when you do, right? So we developed that marketing with our tribal community leaders, with our tribal partners. Our traditions stay alive when you do. We've been hearing stories today and hearing conversations about people that we've lost that have died by suicide and other things have happened in our communities. But one of the things I wanted to say was, every time I hear that billboard, I think about that messaging of that billboard. I think of this young man who lived around the Tulsa area, and he was a great stomp dance leader. Does anybody even know what stomp dance is down here? It's Southwest Oklahoma. You guys might not even know what stomp dance is down here. Anybody? Raise the hands. You guys know what stomp dance is? All right, a few of you guys might be leaders out there in the audience, but with stomp dance, you can tell when someone's a good leader because when they get up to go walk out into the arena, everybody gets up and walks out there with them. So this young man, when he'd get up, he'd go out there, and I heard a couple years later that some things had happened in his life, and he had completed suicide. And I just think about that saying every time I hear it, that culture, that knowledge, that language that was lost, that experience that was lost. And maybe if we would have had something like this back then, it could have helped save his life. But, my job and my role, the cool thing that I get to do is I get to help hold spaces for people. So in our tribal communities, we have blankets, right? And you'll see these blankets placed here later on when we have our gourd dance. You're going to see blankets around the outer rim of this arena where we're going to have a dance later on. And what these blankets mean is, what does it mean when there's a blanket laid down for somebody like this? We're saving a seat, right? So, this is my blanket. I'm saving this seat for me for later on. So think about this when you guys are doing the work that you guys are doing. You're laying blankets for your relatives, for your cousins, your family, your neighbors, We're laying blankets for our community members. And I think if that's what we think about when we're doing this kind of work, we're not doing it only for ourselves, we're doing it for everybody in our community. So I just want to keep that at the forefront of what we're talking about today, that, you know, we're talking about 988 as a resource, we're talking about 988 at the end of the day, but at the end of the day, these are people that are using our services, right? So I just wanted to remind everybody of that today. And, you know, we heard Zach's story, but how many other people would never share a story of something they've experienced as well? I'm excited to be down here in Southwest Oklahoma, excited to see what's happening, but excited to see what happens in our state as we continue to expand and grow 988. So just want to share that with you guys. Remember, you guys are holding space for other people and even for yourself sometimes. But with that, I'm going to go ahead and turn it back over to Ron, and he's going to give us an update on 988 in Oklahoma.
All right, so this was originally kind of pitched to us as a question and answer session, so I'm not sure how well that works out. But I'm just going to give a brief overview of what kind of services that we offer in Oklahoma. In Oklahoma, we really have a progressive crisis continuum. We have the full spectrum of recommended crisis services, and we are a leader in the nation as far as our crisis continuum and our 988 response is. I just want to take a second because a lot of the things that were put together, the 988 call center response, our mobile crisis teams, we have urgent recovery centers here in Oklahoma all across the state, which is a brief stabilization time for people experiencing all types of crisis to be able to talk to a multidisciplinary staff and get those crises addressed at the lowest level of care possible. You can tell I work for the state by the way I talk, by the way, but also crisis centers. All of this stuff was put together by our visionary commissioner, Carrie Slatton-Hodges. And I don't know if you guys have heard this yet or not, but Carrie has accepted a national opportunity and will be leaving us in this position soon. But I just wanted to take a moment and give her a round of applause because with her vision, we are all kind of came around together, and she's just done such a great, fantastic job for the state of Oklahoma, and her presence and her vision will be felt for generations to come. So if you guys will join me in giving a round of applause for our Commissioner Slatton-Hodges. Thank you, Carrie. Again, what I was saying earlier is we're trying to get the message out around 988. As you can tell, I've got the shirt on, the hat on. You'll see messages all around the state. We are united in our grief on what is happening with the fentanyl crisis and the methamphetamine crisis, because our #1 overdose is fentanyl mixed with methamphetamine, right? So we are united in our grief about what's been happening. But then we are also united in our response. And so it's so beautiful. I agree, like hearing Zach's story and many stories that are coming out of the 988 process, the crisis process. You'll see here in the corner, we have a Narcan vending machine. We are putting those throughout the state. So I think you just have to put your zip code in and you can get free Narcan and fentanyl test strips. And we know that that definitely is saving lives. So if you have any questions around that, we can answer that. We have, again, our 988 director here. So if you have any questions whatsoever around how that works or how that operates, feel free. We have a statewide mobile crisis team. So what we try to do is stabilize crisis at the call center level, and Solari's really great at that, stabilizing over 90% of calls at the call center level. If a mobile crisis team needs to be dispatched, again, we have statewide mobile crisis teams. In urban areas, our response time is less than an hour. In rural areas, because you guys know there's a lot of area to cover in Oklahoma. Response times can be up to 2 hours, but we're constantly working on those response times. And then we can try to community stabilize at that level. All teams consist of a licensed mental health counselor, a PRSS, and or a case manager. So we're trying very hard to stabilize whatever the crisis is at that level care, and then engage the consumer or engage the person into services with their local provider. If it cannot be stabilized in the community, then we can transport to the closest urgent recovery center or crisis center, whatever is closest, and then begin the stabilization process at that level. At the urgent recovery center and at the crisis centers, we work very hard to stabilize a wide range of issues. But what's also important is that we have residential substance abuse treatment centers all throughout the state, and if necessary, we can stabilize somebody. So let's say somebody was revived with Narcan, and they were brought to an urgent recovery center. We can help stabilize that situation, offer detox if necessary. We're working to provide Suboxone treatment if that is appropriate and the person wants that MAT services, medically assisted treatment. We can work to get that person into residential substance abuse. We can work to get that person into housing. We can work to get that person into outpatient services. I guess my point is that we are trying to offer the full range of whatever it takes to stabilize the crisis and get that person onto the road of long-term recovery with as many supports as necessary. And I'm so honored and grateful to be in this role and to work and see everyone coming together on this response. We have a long road ahead of us. But this is a fantastic start. The turnout here, I mean, honestly, like it brought me to tears earlier this morning, and I am not an emotional person. But so thank you so much for coming out and being a part of this. And with that, if there's any questions, please just stand up and ask, and we'll do our best to address any questions.
Hey, Ron, I have a question for you guys. So first question, I stood up, is how is 988 Oklahoma Crisis Continuum Care interacting with our Oklahoma tribal nations?
Well, that is a good question, Josh. Tony, why don't you answer that?
All right. As y'all can tell, I'm not like a big speaker in front of people, so I get super nervous. So I'm wearing the MC Casey, right? Casey mentioned my shoes, and so these help me feel more comfortable. They're like my safety blanket. My kid also, I have a 14-year-old. Anybody have a teenager? Like, he tells me all the time how uncool I am. So, but he has some like these, and he says that they're pretty cool. So I feel cool when I'm wearing these. But how do we interact with the tribes? Well, we talked a lot about, so 988 is just a piece of the puzzle, which I mentioned earlier. It's a starting point. And so a lot of people, we have all these great resources that Ron just mentioned, and so many great things that so many different entities are doing to serve people that are needing help, right? But sometimes people just don't know they exist or don't know how to access them or where to go. 988 is that great starting point. When you don't know where to reach out to, if you're struggling, and we can connect you to resources. So, and one of those resources that we're connected with, and with so many of you here, is the tribes. The way we're working with the tribes right now is collaborative. You guys are doing so much great work in your communities, and so we want to be able to connect folks to that in the way that's most appropriate for them. And so what we've started doing is working with the tribes on a pathway. So we wanted to have a pathway to get folks connected to the tribe that's in their area that's able to serve them, or their tribe. And so we've actually have a policy and a procedure, which I don't think many other contact centers, if any, do in the rest of the United States, where we have a pathway to get folks directly connected to them, and we've have a procedure set up with our staff. We have it entered into our phone system, those numbers, and have worked collaboratively with those tribes. Right now, we have a relationship with the Chickasaw Nation, Choctaw Nation, Iowa tribe, and then now the Muskogee Creek Nation. So we're really excited about that, and we're keeping adding on to that. We're constantly talking, having those conversations. How can we best work with the tribes and make sure that we're getting folks connected to the right resources? And another thing that y'all are doing that I think is so helpful is getting the word out, like Ron had mentioned and Josh had mentioned, is we have a lot of folks reaching out to 988 right now that are in our big urban areas, so Oklahoma County, Tulsa County. We got a lot of people reaching out in those areas, but one area where we're still needing some folks to know that we're here is in those rural areas. And I think y'all, everyone that's in this room can have a big part of that, getting the word out in those areas. And but that's all I have right now.
All right, questions? You want to stand up? I can give you guys the microphone real quick. Anybody? I'm just going to start calling on people. Questions? All right, you got a question?
How does the 988 relate to children or adults?
Yeah, we serve the whole spectrum. So if you're 0 years old all the way up to 100, and what's the oldest person right now in the world? So we serve the whole age range. So it doesn't matter if you're a child, an adult, you can reach out to 988 and we're gonna help you. It's a no wrong door.
You might have said this earlier and I stepped in late, but how many calls have come into Oklahoma 988 since it started?
Oh, you would ask me that, Carrie. That's a good question.
Do I need to answer?
I don't know the exact answer. It's over 50,000.
Very good. What do you know on texts?
I think we're hitting over 5,000 texts since July, so somewhere around there, I think.
And then one of the things I think is important, but I'll ask you the question anyway, is that, so in Oklahoma, when we set this up, one of the things that we wanted is for calls to be answered in Oklahoma, because it's really hard to link someone to resources if you're calling and you're being answered nationally, because they're not going to be able to have that personal touch of saying, hey, would you be more comfortable going to a tribal organization for your services? And let me tell you what those are. And so in partnering with Solari, one of the things that has happened is we have close to a 96% in-state answer rate, which I think is really phenomenal to have stood up and been able to do that. And we really thank you, Solari, for Tony with Solari, for all the work that has gone into doing that, because we know Oklahomans can better help Oklahomans, but we've got to be the ones that they're connecting with. So I really.
Yeah, I think that is a big part, because Oklahomans, we have a culture here, right? And it's helping people. We take the time to get to know people. We know the land, we know the areas around here, we know the resources. So all my staff that I have, it's a diverse staff, and they love helping people. And most of them have a story themselves too, and that's why they got into this. And they really care and want to help folks listen, de-escalate, safety plan, get folks connected to resources, and just meet the need wherever they're at. So.
My name is Dr. Jerez, and I own an outpatient mental health clinic here in Lawton, Oklahoma. And it would be helpful for us to understand how the whole flow goes, like when somebody calls into 988, how does that trickle all the way down to an outpatient mental health clinic in the community?
Yeah, so if someone reaches out to 988, there's multiple ways they can. First of all, in order to talk to us, they need to have an Oklahoma area code as part of their phone number. The way the system's routed is by your area code. So if you're going to talk to the contact center here for Oklahoma, you will need that Oklahoma area code. But once they do talk to us, they can remain anonymous. That's a big piece of it and an important piece of it. Sometimes folks won't reach out, if they feel like someone's gonna, track them down, or they're gonna be, or someone's watching them, or knowing where they're at. So we want folks to be able to feel safe to call us, and so that's a big piece of it. So we do ask that information, but it's not necessarily required. So the first thing that we're doing though is figuring out what the need is, and so they're going to tell us what's going on, and we're going to listen, and then the next thing we're trying to do is see if we can de-escalate the situation if it is a crisis, or if it's a resource they're needing. We're going to do that. We're asking about suicide every single time. That's one of the most important things we do, is we're checking to make sure that person's okay if they're wanting to harm themselves or anyone else. Our goal is to de-escalate. We're going to safety plan, and then we're going to connect that person to the most appropriate resource that fits their need. If they're connected with an outpatient clinic, we can get their consent, and we can help connect them to that outpatient clinic. If they would prefer us just to give them that information, we're able to do that too. We have a wide range of services that we connect them to. So that would be kind of how that flow would work. We do have the options if we need to send a mobile crisis team if they need that level of care. Those mobile crisis teams are excellent at assessing as well, in person, and then they're able to also connect to those resources that are in the area as well, because they know it really well themselves, because that's where they live and that's where they're is in that area. So, did that answer your question? And like I said, to call 988 doesn't matter who you are. We catch everything, so it's no wrong door. Any other questions? We got a couple over here, Josh. Sorry.
My name's Melinda, and I work in outpatient and inpatient services. Could you tell me the credentials of the people who are answering these phones and text? What qualifies them, and how many do you have on staff at any one time?
Yeah, that's a really good question. So we have about 43 people on staff now and growing. The way it works is, so everyone that's answering that phone call is a bachelor's level or above. They're supervised always by a clinician, and that's somebody, LPC, LADCMH, LCSW, or which one am I missing? LMFT. I'm sorry, LMFTs, if there's some in the room. They're supervised by one of those for each shift, so they're taking those phone calls. They've had a lot of training, so we have initial week of training, and then they go into a mentor status, and so we keep them in that status until they are ready to go out on their own. So they're listening to calls. If they take a call, they have somebody on there with them at all times. The way our system works too, our clinical staff and our supervisors are able to listen to those calls at all times. If they need to, they're able to jump on, they can take it over. They're there supporting that team throughout the whole process. And so that's kind of what that looks like. That structure really makes things work, having that person that's able to take the phone call, but also having that clinical support above them too. So does that answer your question?
How many, I think the other part of the question was how many staff do you have available?
At any given time?
Yeah.
So in order to be most efficient and effective and use our resources in the best way, we have a great workforce manager, and she basically, we look at the amount of calls we're getting at any given time, right? So there's certain times so like at 2 a.m. we're averaging probably about 3 to 5 calls every 30 minutes, and so we're going to have less staff during that time. But during those times that we have getting up to like 20 calls, every 30 minutes, we're going to have a lot more during that time. So at any given time, it's in between like 5, and sometimes we'll have 10 staff working. Just depends on what time of day it is and when that call volume is highest or lowest.
Hi, my name is Jade. I work for an abstinence-based sober living program, and my question for you is, I heard you say that y'all often help individuals get onto Suboxone or methadone to help them find those services. My question is, if an individual does not want to be on that services for long term, do y'all have resources for them to taper down and eventually get off of them?
Hi, so our Suboxone program through the URCs is pretty specific to the region, and so if a person does not want to stay on those services for long periods of time, then they just work with that program with a clinician that they're working with to taper off and then engage hopefully into outpatient services or whatever they're going to do in order to help maintain those therapeutic engagements. So. Yeah.
Any other questions? Oh, we got one right here. Uh-oh, Ashley. Is it going to be a hard ball?
Do I give her the mic or no?
I don't know.
Morning, my name is Ashley Taylor. I'm the Director of Behavioral Health at the Iowa Tribe. So a couple of questions that have been brought up. What training is required for the staff that work at Solari, and is there specialized training for working with the youth?
All right, that's a good question too. Yeah, so we've developed, so we are accredited through the International Council of Helplines, and they have some certain requirements as far as the training. We have our own internal policy as far as what we require and what we want. So we've developed our own training at Solari that's internal. We also receive a training through Vibrant, which is the Lifeline. So they have training too that's also required before folks can answer those calls, texts, and chats. We also, I like to be an A+ student, and so I want to, do as well as we can too. So we actually do some extra trainings too, regarding like cultural competence, making sure we're hitting all those different diverse areas too, like with the tribes, with the youth, which we have a special training through that. That's part of that initial training that they get in that first week. They also get that on an annual basis, and then also like older adults, and then many other of those groups too.
So following up on that a little different. So tomorrow we're going to talk, a couple of us are going to talk a little bit about what our warm handoff and our workflow process is with working with Solari, getting individuals resources at their tribal communities. What does that look like for the other, if they're not in a tribal community or those resources? So if they're going to their just local mental health agency, what do those warm handoffs look like?
Yeah, so it's very similar to what we do with Ashley with the tribes is so there's CCBHCs that are located, or if y'all don't know what CCBHC is, it's the Certified Community Behavioral Health Clinics, and they're formerly known as as Community Mental Health Centers, and they're kind of a level up from that, right? And so they have some more that they do, and to really serve the people they serve, but we have a direct pathway to those as well. And so usually if that person is not connected to any services and they don't tribe, and that wouldn't be most appropriate, we're probably going to connect them with the CCBHC in their area, and they provide the whole spectrum of services, and they can also help that person get connected. If their services aren't the most appropriate, they can help get that person connected as well to whatever service is most appropriate. Any other questions? Oh, we got some more. Oh, are we over time? Do we have time for more questions? Are we past due?
Let's get this one last question.
Yeah, we're 24/7, 7 days a week, holidays, weekends, all the time, every day, all day, every day. We're going.
I think we have another session after lunch, so if you guys think of anything else that you'd love to ask, we'll be here all day. We really appreciate your time and focus, and again, thank you guys for coming and having us, and we look forward to working with you now and in the future.
Yeah, thank you all so much. And oh, yeah, thanks.
Hello, check. You should have said what you were going to say. I'm right here.
I was just going to say, like, 988 is a really important piece of the puzzle, but it's not a magic wand. It takes everybody that's in this room. It takes the whole community. It takes everything for it to work. So I just wanted to say that, and I appreciate what all of you do, and thank you for giving us the time to talk to you.
All right, on. Good information. All right. Right on, guys. Right on. So next part of this beautiful agenda is, all right, ladies and gentlemen, we're going to bring up Casey Nicholson. Yeah, hey there, guys. All right, let's just keep it going. I'm loving the flow. I'm loving the vibe. Well, hey, Panita na nisa wasnaka Casey Nicholson na sihina ninana ani no one ni sin nanikit adehi. Today's a good day. My name is Casey Nicholson. I introduced myself at the beginning. I am the MC and also your keynote speaker from here to noon or to lunchtime. And if none of you all seen me speak before, I'm very energetic. I'm very passionate about what I say. I like to move a lot. I would like to say I'm just very passionate. I'm just straight up passionate about what I do. And a little bit of backstory. I am from Fort Belmont, Montana. I am an only child from my mom. But my dad ended up having a bunch of kids. Let's just go there. Just a bunch of old kids. Like, I don't even know all my half brothers and half sisters. That's how bad it is, okay? And I never grew up with a dad besides my own uncles and my older male cousins. And I moved all over the country. I was born in Billings, Montana, and then I think I moved over to Portland, Oregon, then Gallup, New Mexico, Aberdeen, South Dakota, back to Billings, Portland, all stopped in St. Louis, all the way over to Silver Spring, Maryland. And then from Silver Spring, Maryland, I moved to Fort Belmont, Montana. From Fort Belmont, Montana, I went to Bozeman to grab my undergraduate in health and human development, specialty in family science. Took a couple years off. IHS called me and said, hey, do you still want to go to school? I'm like, yeah, for what? Well, you applied for the drug and alcohol counselor scholarship through IHS. And I was like, oh, totally forgot about that. Yeah, let's go back to school. So I went back to school to become a drug and alcohol counselor, but I didn't get it in that degree. I ended up getting it in mental health counseling and rehabilitation services. And so that's what I went and got my master's in. Then again, I went into, grabbing my license and going into the behavioral health field. And then, like I said earlier, and this is where the journey starts. This is where my motivational stuff started coming to fruition. As I started going into my professional career, something happened to me that I wasn't quite understanding. And there's this thing called life, the ups and downs. But as an only child, I never had an older brother or a dad to sit me down and said, son, this is the way life is. This is the way life goes. Now, credit to my mom, she only knew what she knew. She gave me everything she could possibly have. But at the same time, with what she gave me, she also gave me the good and she also gave me the bad. But I do not blame her because I wouldn't be the person I am standing up here without my mom. She loved me unconditionally and she still loves me unconditionally. She is my role model, along with my grandma. And when I was sitting there and I was wondering, how do I figure out this thing called life? How do I figure out these relationships that I ruined, through my part? How do I commit and really sacrifice to the things that I want in life? And yeah, I went through bouts of depression. I went through little thought suicide. Never in a million years would I ever commit, but I remember that one day vividly, I was at actually a conference. And this is a wellness conference. And I remember hearing this guy talk. And he asked the question, have you ever thought about committing suicide? He just asked that generally to the audience. And before he prefaced it to, before you answer this, think hard. Have you ever thought about it? So I sat back, leaned back in my chair. I did the, And this just like a film reel, zzz. And I remember I said, and I remember the thought that I had. And this is a time in my life that I was not happy. This is a time in my life that I was uncertain what I wanted to do because I was going through some hardship. A lot of trauma was surfacing at this time. And as this film reel was going through, zzz, I remember him saying, have you ever did that? Have you ever thought about the suicide for yourself? And I remember my mind and my heart or something spoke, almost like, angelic. Something out of nowhere came, poof, just like that. And I remember telling myself or asking myself, what would happen if I wasn't here? Never did I ever ask myself that before. I always knew. I always figured what I wanted to do with my life. I always had this plan of what I wanted to accomplish in my life. And when that question came or that answer came, what would I do if I wasn't here? Scared me so much I just went, and I stood right up and I was instant panic attack. I just walked right out of that room. And I'm like, and I remember they said there's a smudge room. If anybody needs a smudge room where you go smudge and you cleanse yourself off, you need to breathe, you need to relax, there's somebody there with some smudge, sweetgrass, cedar, sage, whatever it is, and go in there and I remember just like, do I need that? Like, do I need that? Like, oh, holy man, what's going on? Like, I never had that thought before. What's going on? And I just went right into my brain thinking, what is going on? I've never had this experience before, never I even questioned or doubted my life. And at that moment, I doubted my life. I was questioning who I was and what I want to be in life. And in that moment, it brought me back to another time where I had a panic attack and anxiety attack, and I was working for Missoula Indian Center's behavioral health program. And I remember I was butting heads with the director. The director didn't have any knowledge about mental health, drug and alcohol counseling, and we're butting heads. And I'm like, that's not the way we can do it, but we're just butting heads. And I found myself getting really defeated because I couldn't have no movement with this director. And it's like, and I got really frustrated. And I remember, I said, all right, I'm gonna forget about it, whatever. Okay, you do you, I do me kind of thing. And remember, I love golf. So if anybody ever wants to golf and I'm around the country, let's go golf. Anyways, here we go. So I'm golfing, right? And I hit my shot. And I remember that was a good shot. And as I'm walking to my ball, I felt this rush of heat, this rush of heartbeat. It went my heart was in rhythm, right? And I also went like it went 100 miles an hour. And I was like, whoa, what is that feeling? My hand started shaking. Someone said, what is that, when you're feeling like this tingling in your left arm, whatever that is, someone was saying that, and I was like, oh my God, like, what's going on? Like, holy man. And I finished out my 3 holes and got on my ride, and I was going down the road, and on the left side of the road, there's a hospital. And so I'm looking, I'm like, you should go check in. Just go check what's going on, because this is a weird feeling. You've never had this before. I went down, and I was like, no, I'm good. I parked into this one store called Shopko. And I'm in this parking lot, and I'm like, holy man, I'm literally arguing with myself on to go get help. No, you're good. No, you're not. No, you're good. No, you're not. No, you're good. No, you're not. No, you're not. Get to the hospital. So I got to the hospital, got in there, got checked in, and they put me up to the arm pressure cuff and the finger monitor, oxygen monitor. Oxygen was good. Just sitting there, my heart rate was like 120. And my blood pressure obviously was high, right? And so that the nurse that was helping me, oh my, and I'm like, what? What do you mean, oh my? Oh, nothing. I'm like, huh. And all you hear is, as I'm sitting there and I'm shaking, the adrenaline's pumping, right? And I'm just like, oh man, what's going on, And I hear that, doot, 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 doot. And I'm like, could you please shut that off? Please shut that. Is freaking annoying to me right now. I don't want to hear my heart rate like, doot, 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 And then the little arm, I'm like, oh my God. And so I'm just like, I am like just in a state of panic. I remember the nurse practitioner or doctor came in, and she was a female. She sat down, and she's like, hey, Casey. I'm like, hey, how's it going? She's like, what brought you in today? What's going on? And as soon as she said, what brought you in? What's going on? I took it as a freaking, like a green light to just divulge everything. And I swear, this doctor sat there and listened to me for like, I don't know, what I felt like was like 3 hours. It was probably only like 10 minutes. But I was just like, and I was just unloading. And she's like, Casey, okay, can I tell you what's going on? I'm like, yeah, tell me what's going on. And they did the blood test and everything. She said, first, everything's good. Your, blood work came back fine. You're a little low on your potassium. I'm like, okay, that's probably, I probably know why, because of stress, And she's like, and second is, you're having a panic attack. And I'm like, what? Like, no, wait, I'm a counselor. I'm a counselor. I don't have panic attacks. I counsel people who have panic attacks. Well, that's what you're having, and, A, B, and C. I'm like, holy cow. And so in that moment, and she, obviously referred to go to a counselor. I already had my connections. I'm like, all right, well, I guess I'm going to need to go to a counselor because something is going on. And for the longest time, even with my ex, I always saying like, no, I don't need a counselor. I'm a counselor. I'm good. The whole denial aspect of it, I'm good. I've done my Sundance. I've sacrificed. I'm spiritual. I've done all these things to really balance out my life. But lo and behold, at the end of the day, I wasn't balanced. I was in denial. I was refusing to really look deep within, like way down, to see what the cause of what was going on. And it wasn't the job. It wasn't the ex. It was nothing like that that was causing me to come to light to see my own, some people say demons, their shortcomings or whatever. And it wasn't the shortcomings that was making me feel this panic. It was nothing like that. There was something within inside me saying, Casey, you're not happy. And if you're going to refuse to look, I'll give you a panic attack, so I'm going to force you to look at yourself. And me as an individual, as a counselor, a mental health therapist, knew that I did not want to go on freaking medication. I know it's very helpful to other people, but I know how addicting it can be. And it is a Band-Aid for me. It was going to be a Band-Aid for me. So I said, you know what? I'm not going to take any medication, no matter how many panic attacks I have, no matter some anxiety thoughts I have, I'm not going to. So what I ended up doing is using all the resources that I possibly could have to get myself out of this rut. I dug deep down inside to figure out what was all going on. And realizing the trauma that as I grew up as an only child caused a lot of pain and misery for myself that I refused to look at. Thinking when I was sexually touched inappropriately, it was a dream, but it wasn't a dream, it was actual fact. When I seen certain sexual things being done from me, thinking, oh, that's just a dream, that's nothing, I'll be fine. And as a 7, 8-year-old, not realizing what I just seen and stuffing it in. And not having the coping mechanisms or the bravery to say, hey, this is what I seen and it really hurt me and I'm lost and I'm scared and I don't know what to do. Growing up as an only child and not having friends and going to all these different schools and realizing all that fear and that anxiety was stuffed down and not realizing how I could ask for help, who I could reach out to because I'm in a new community. I lived with, my white counterparts. I lived with my Navajo counterparts. I lived with my natives. I lived with my black counterparts. I lived with so many different races. In each different town or city that I lived in, I felt lost and I felt scared and I felt vulnerable and I never knew how to ask for help. So I put on this facade of a person lying to the person in front of me saying, please accept me. And as I kept reaching through all these things and journaling, because as soon as I reached out to my resources after this panic attack, I went to my resources and I started journaling. And the journaling right away was negative, just tons of negative. I started smudging and praying. I started listening to all the freaking motivational videos I could find, all the books I could find to fill my brain up with all the positivity that I could possibly fill it up with. Because all my life I was filling up with negativity. I'm ugly, I don't like the mole on your nose, you look, you don't look native, you look Asian, like all these, and I'm not saying that's negative, but that's what people were telling me. So I was believing and coming into a culture of like not believing in who I was as an individual. And not realizing and being scared of who I was and what I wanted. Having this loss of culture, this culture identity conflict, identifying with everything else but my own culture. It was a scary moment for me in that moment when I had a panic attack because I didn't know what tomorrow was going to bring. But all I had control of in that moment was that moment, that second, that minute as I'm writing this stuff down on a pad. All this, I'm ugly, I'm stupid, I'm dumb, I can't get through this, I'm scared, I'm fearful, all these things. And I remember in school, in mental health, it's, try to replace it with, 5 positives or 6 positives, 5 positives for every 1 negative. So I went in there and I started writing positives, even if I had to repeat it. So I wrote all this negative, all this junk on this piece of paper. And then I flipped the page, and I started writing nothing but positive. Even if I had to repeat it, I'm healthy, I am great, I am loved, I am successful, I am prosperous, like all these things, I am spiritual. You know, I started writing over and over and over, like 2 pages of positivity. And then this is my routine. I'd write everything down on the piece of paper, negative, positive, and I'd sit down, and then I would pray. So I lit this smudge, and as I smudge, you know, Creator, grandfathers, you know, help me out. I'm really scared right now. Grandma, I know you're on the other side looking after me. Please just watch over me. Crying, let it out. And then I'd sit there, and as that burning ember of that smudge was burning, I just started taking deep breaths. Feeling my body shake from the adrenaline, feeling my heart rate, because I'm in a state of panic. Telling myself it's going to be okay, you're okay, you're okay, you're okay. Over and over and over, you're okay, you're okay. Crying a little bit more, you're okay. And then when I started calming down, I went into like a meditative, like I said, I went into like a little meditative state, and I just allowed myself to feel everything that I could possibly feel. My fear, my hurt, my pain, a little bit of grumbling in my stomach, everything I could possibly, I just allowed myself to feel it because that was the moment. Allowed myself to hear the things that were in that house at the time, hearing the little pops and snap, crackle pops of the smudge burning, smelling the smell of sage or sweetgrass, whatever I chose to use at that time. And then really going into this place of gratitude, realizing I ain't promised tomorrow. What are you going to do right now? In this moment, what are you going to do? I'm going to be thankful for everything I have. So I started being thankful for everything that I have. My little feet, my little fingers, my little nails, eyelashes, eyebrows, my little windy eyes. He's right. My hair, my life, my kids, my relationship, my shortcomings, my failures, my pains, my successes, my education, my family that loved me, my brothers, my sisters. And as I started doing this gratitude, I felt anxiety kind of going away. I felt this negative feeling kind of going away, and I'm realizing, wow, I have way more to be grateful for than I have whatever I'm focusing on, this negativity. And it really catapulted me into this world of motivation and understanding. And I really wanted to kind of like, there's got to be something that I can do for my people. And I'm not just talking about my tribal people. I'm talking about people, like my people, like human beings. I don't care if it's polka dotted, striped, black, white, Mexican. I don't care who it is. That's my people. Because at the end of the day, we all bleed red. At the end of the day, we are human beings, and we are not perfect, period. We all have our shortcomings. We all have our trials and tribulations. We all have our successes. We all have our love. So at the end of the day, I was sitting at the end of the day, and every day that I had the anxiety attack, trying to talk myself through this, I was really sitting there and realizing, what can I do, not only for myself, and how can I help people get through this that I'm going through? And I said, you know, this was during a break, a Christmas break, and I went back down to Missoula, Montana, and I was realizing, as I'm sitting in that job, I'm not happy. I am not fulfilled. I am done making excuses for myself to not be happy. I'm tired of living my life based off of what other people and how other people see me living. Now, I'll tell you this. The reason why I'm telling you this is because my mom, and the reason why I moved all over the country, is because my mom worked for IHS or BIA. Most of my family worked for the government, BIA, IHS. Beautiful, beautiful retirement and good, all these, very secure, and you move up the GS scale, all these things, So when I went to college, that's what my mindset was. But there was a burning desire inside me to do something more than that. I didn't want to just sit, and I'm not against it, but it just isn't for me. There was a burning desire as I was sitting in an office 8 to 5 grinding that it just something wasn't for me and I wasn't happy. And I realized when I was sitting there that I was living somebody else's life expectations. Not because they forced it on me. They didn't force it on me. But I chose that because I thought that was the way life was supposed to be. And it wasn't when I realized that there was a sense of freedom like, oh, holy Christ. Yeah, he's right. I scared you. But I understood what it was. And at the end of the day, that's what it was. It was a beautiful moment of realization is what was going to make me happy. No one else is going to make me happy but who? Yeah, me. I have to choose that for myself. So I went back to the job. I did it. I tried it out, but nope. It's just not connecting. There's something greater for me out there. I'm not saying that job for me is going to be greater, more rewarding. So I went back to my apartment, and the ex was going to law school at the time, and I went in there and I said, I'm done. I'm done. I can't do this anymore. And she just broke down. She's like, what are you talking about? We're done? I'm like, I'm done. No, what? Huh? No, we're not done. I mean, I'm done with my work, right? And she's like, oh, I thought you said done. I'm like, no, I'm done with work. She's like, what do you mean? I said, I quit. I'm going to quit. I'm going to give my 2-week notice, or probably a 30-day notice, just to help transition other counselors through. And she's like, are you sure? And I'm like, yeah, I'm sure. And I broke down. I broke down crying. And I started telling her the things that I was realizing and how unhappy I was. And this is probably the best thing that my ex said to me was, I understand it and I support you. If she never would have said that, I probably would have stayed in the job. But when she said, I understand, I support you, I could see that you're unhappy. And I'm like, I said, well, I don't know what to do now. You know, I've done talks here and there. I've done some comedy shows here and there, but never full blown. Like, holy cow. And this is a very vulnerable, scary situation. To dive into a dream that you've always had, and I've always had this dream of being a comedian since 12, 13 years old-ish. Yeah, no, before that maybe. And I remember the dream started when I would stay up late rebelling out and watching Def Comedy Jam on HBO. And I remember watching these comedians on stage making all these people laugh. And I'm like, that looks fun. I wouldn't mind trying that out. And of course, you know, if you guys ever watched Def Comedy Jam back in the days, it is not for young kids, right? But I'm there. I'm picking up language. I'm figuring these jokes out. I'm figuring their cadence out. I'm figuring everything. I'm like, dang, that's really funny. Like, I don't know what they're talking about, but that's funny, you know, right? And that's what kind of started the mindset of, like, I wouldn't mind becoming a comedian. When I was in 8th grade and in Silver Spring, Maryland, I went into it. It was about a week before school ended for summer break. And I went there, and I sat down, and, you know, middle schoolers, you know, their minds all over the place. Hormones are going, so we're just sitting down. We can't sit still. It's almost summer break. And our teacher kind of had this, you know, I don't know, well, most of us are kind of in that age range where they had the projector. You know, they had the little, you know, the spray to wipe away the marker, you know, that kind of thing. And I remember on the projector, it said, 10-year letter. And in the 10-year letter, actually, you know how teachers always will have that piece of paper and they kind of move it down so you can't see everything. So she moved it down and it said, Dear blank spot, it's 10 years from now. This is what you said you're going to be, ... And she ended up handing us a bunch of envelopes. And she said, address it to somebody who you think or know will not move or who are responsible enough to do an address change. So I thought of my auntie. So I addressed it to her. Put Casey Nicholson. I didn't put a return address on mine, but I put an address to, you know, to the send it, to where I was going to send it. And so then got that and then grabbed a piece of paper. And she said, write this down on your piece of paper. So I wrote it down. Dear Casey Nicholson, it's 10 years from now. This is what you said you're going to be, ... You know, as middle schoolers, you look around, and you're like, oh. And look around, and all my buddies, they were into it. So I was like, oh, okay, well, what do I want to be, you know? What do I really want to be? And I sat there for, I don't know, probably 5-10 minutes, just kind of like playing with the pencil and just kind of like, I don't know. What do you be? And I remember one of my favorite football teams. I know you guys probably, ooh, but anyways, Chicago Bears is one of my favorite football teams. And I always wanted to be like Walter Payton. Sweetness, right? So I was like, I want to play for Chicago Bears. So I didn't want to play for Chicago Bears, but I just put professional football player. And then I remember scribbling it out. I was like, well, before I become a professional football player, I have to go to college. So then I put be a college football player, college baseball player, college basketball player. And then on the bottom of that was professional football, professional baseball, professional basketball. And after that, it was go to college to help my people. I didn't know what I was going to go to. I didn't put psychology, sociology, or anything like that. I just put go to college to help my people. And on the bottom of that, I had to have a dream woman, right? I had a dream woman. Long, dark hair. Sorry, blondes. Haze, right? Dark, succulent eyes. Sorry, light eyes. Nice feet. Hey, right? I've heard some funky feet before going through sheets. Y'all got to file that down, right? Okay? If it sounds like freaking tinfoil, you need to shave your feet down, okay? If you freaking shake the sheets and there's a bunch of white dust, you need to shave your feet, okay? What? I'm just joking. It was like, oh, yeah. Anyways, back to my letter. Let's get focused here. And then I remember putting, I was just reaching, respectful, honest, courageous, all these other things. And at the very bottom of my 10-year letter, I remember putting comedian and then actor. And I remember, dotting it, folding it, sealing it, and then giving it to my teacher. And never, as soon as I gave it, I was like, la, 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 summertime, here I come teenage, here I come college. 23 years old, I get a call. And back then, our cell phones really kind of weren't very good. You had the pull-up thing, and you're, hello, can you hear me now? Can you hear me now? Kind of thing. And I found a good reception, and I was walking to school at MSU Bozeman campus. And I was walking to school, and I got, and I was like, hello? And she called me like 4 or 5. She's blowing up my phone. This is my auntie. And so I finally answered. I was like, Auntie, what's going on? She's like, hey, do you got a minute? And I'm like, yeah, I got a minute. What's going on? She's like, I got something to tell you. And as natives, we're traumatized. As soon as we hear that, we just instantly think negative, right? Someone passed away, someone got hurt, someone got in a car accident, something happened. Oh, I got something to tell you. I'm like, oh. So I kind of went away from everybody. I was like, you can tell me what's going on, Auntie, what's going on? She's like, yeah, you got a letter. I was like, what? I got a letter? I was like, that's not even that bad. I thought it was going to be worse. She's like, no, that's not the weird part. That's cool that you got a letter, but the weird part is you got a letter to yourself, from yourself. And I'm like, what? I wasn't that drunk or high in college, was I? In my freshman year, right? Was I, writing myself letters? She's like, no, I don't know, but it just says Casey Nicholson, and then has to Casey Nicholson this address. And I'm like, what the heck is going on? And so I was like, I don't know where this letter came from. I don't. I'll come to Billings. It's like 2 hours away from Bozeman. I said, I'll come to Billings this weekend and I'll check it out. She's like, okay, well, love you. Okay, bye. Click. And I'm walking to class, la, la, la. And then my mind is turning like letter, 10-year letter. Not even letter, but where does this letter come from? And all of a sudden I was like, open this door. And I'm like in this world of thought, right? I open the door and I'm really thinking. And this girl come walking in, and I totally just screamed. I was like, oh! And she's like, oh! And I'm like, I'm sorry, my bad. And she's like, what's going on? I'm like, I got a letter. She's like, you're a weirdo. I'm like, I am. Sorry, I got to go. And I totally just skipped class, and I went right to my little Nissan Sentra, a maroon Nissan Sentra with 4 different tires. It was college time, right? 4 different tires. And I remember at the time, Montana didn't have a speed limit. And I'm on I-90 really fast, probably about 90, 95 miles an hour. And my car I don't know if it was going to make it. It was just shaking, right? I pull up to my auntie's, and I run up there, and I knock. And she's like, come in. I come in, and I was like, where is it? And she's like, it's right there. And I'm like, oh, my gosh. Now, I don't know why I did this, but I did it. I smelled the letter. I don't know why I smelled the letter. That's weird, right? That is weird. I was like, ooh, that doesn't smell like 10 years, And I opened it. And I unraveled it, and I looked, and I was like, oh, my gosh. First thing I said was, I write exactly the same. From 13 years old, nothing has changed. I write exactly the same. And I'm like, this is so cool. And I started reading it, and she's like, well, what does it say? So I said it. I said, dear Casey Nicholson, oh, that's me. It's 10 years from now. This is what you said you're going to be. Mind you, I never thought about this letter for those 10 years. And I looked at it, and it's a professional athlete, all those ones. Nope, right? College basketball, woulda, shoulda, coulda. I passed up on a couple NAIA scholarships, and I didn't take them because I followed a girl to school. Then I was going to try out for Bozeman. I had a really good prospect, but there was 4 guards, and, playing time for the first 2 years was probably going to be nil. So I was like, nah, I don't want to play. And then so I stayed at the school, so I was like, nope. College football, college baseball, nope. Then I went into school. You're going to go to school to help your people kind of thing. Like, oh, yeah, I am. Cool. And then dream woman, I was like, sure, I don't know. And then it went down, and I started checking and crossing things out. At the very bottom, the things that I didn't get to, the comedian and the actor part, I just kind of looked at it and I said, I don't know, maybe one day, I don't know. We'll see what happens. And then I folded back up. I gave the letter to my mom the next time I seen her. And I realized in that 10 years later how I was setting things in motion and not really thinking about the things that I planned for myself at 12, 13 years old. And how things kind of naturally just played itself out. And how it was playing itself out the way, based off of my decisions, my choices, and my self-esteem and my self-confidence. The things that I seen in myself. And one of the biggest things is, yes, I could have been, would have, could have, should have. I have no regrets. But I could have been a pretty good college basketball player. I know I could have. I could have been a really good baseball player. I was really good at baseball. Football, I had good hands, but not all about the banging around kind of thing, A little too dangerous for me. But would have, could have, should have. And the thing that when I reflect back on that, I was lacking was that healing, that understanding of self. Where an uncle and a older brother, older cousin, even an auntie never really sat me down and said, son, this is what you have to prepare for life. This is how you do a relationship. This is how you respect women. This is how you follow in on your dreams and your goals and your ambitions. This is how you do it. Don't just write them down. Follow through on what you want for your life. No one sat me down and told me that. They told me how to work in a government job by modeling what they wanted in life, but no one ever sat me down and said, if this is what you dream and this is what you really truly want in your life, this is how you do it. And I got you. I support you 100%. I'll do whatever I can do to hold you up when you fall, because, boy, you're going to fail. No one taught me about what failure means and how hurtful it could be, but also no one ever taught me how beautiful it can be, how beautiful failure is, how much of a life lesson failure is. In today's society, we are taught failure is bad. I always think about a young kid, right? A young baby, and we're talking about failure. A little baby looks around the room and says, I want to walk like everybody else is walking. Why am I on the ground crawling? So it gets up, and it's like, whoa, and it goes back down. Little babies that do squats, gets back up, gets back down, gets back up, goes back down, crawls a little bit, gets back up. Well, one day, it has enough bravery, courageous, or something, and innate ability says, I'm going to walk today. And so it gets up, coffee table, wherever it may be, and let's go. Whoa. Oh, that was weird. Okay, try again. Whoa, that was weird. Okay. And then the mom or the dad or the caregivers are looking at this baby. Look, it's going to walk. That's a baby. It's a he or her. It's not an it, right? Baby's going to walk. And so, come on, baby. You can do it. And what usually comes out of their voice is like, oh, you can do it, right? And the baby's like, what is going on? All right, I feel good. I'm going to try, right? So let's go. Takes that first step. What happens on that first step? Usually, most of the time, falls. The baby falls. In today's terms, the baby has failed. The caregivers, not that I know of, never looked at this baby and said, you stupid, dumb, idiotic, failing, worthless, stupid, ugly, gosh, you suck kind of baby, and then kick it, poof, and the baby goes flying, right? No one does that. When they fall, what happens? Oh my gosh, get up, right? And the baby's like, oh man, oh my booty, whatever, it hurts, right? It gets up. And it's being encouraged by the caregivers again. Come on, you can do it. Right? Imagine being talked to that like that. How good that makes you feel, right? See? Look at that. Right? So the baby's like feeling off this positive energy, right? This positivity. He's like, all right, I feel good. Let's do this. And then as the 1, 2, 3 falls, gets back up, 4, 5, 6 falls, 7, 8, 9, 10, 11, 12 falls, eventually gets to the caregivers. Caregivers don't push it away. They say, do it again, that was worthless. The baby is picked up, encouraged, and loved, and supported. It says, you did it. Never said, well, you fell 5 times, and you kind of like buckled on that last step, and so you're going to have to do it again because that was really a poor walk. Caregivers don't do that. The loving people don't do that. They go, you did it. Oh, my gosh, celebrating. Selfie, right? Sets the baby down, do it again. And the baby does it again through support, loving, understanding, great energy, positivity. Why do you think that baby walks? Because the caregiver nor the baby were defining failure. Every fall was a success. Every fall was a moment of triumph. Never once did I know that the baby thought, oh gosh, I'm a failure. I freaking fell off. I fell like 10 times through that walk. Like, what am I thinking? They're totally right. I am worthless. I'm nothing. What kind of human being am I? Never once. That baby is taught the definition of failure through us as human beings, as adults, because of how we were conditioned to believe what failure was or is. If you change the perception and your mindset of what failure can be, we have so much success. We have so much better mental health. I know when people mess up, we tend to like really criticize them and ridicule them, saying, what are you thinking? You know better. When I lost my relationship, I cheated on my lady. People were criticizing and ridiculing me. And I'm like, I didn't even know how to do a relationship. No one ever modeled to me. No one ever sat me down and said, this is how you conduct yourself in a relationship. This is how you show love and support. This is how you treat a woman that you love. No one sat me down and said that. And so how am I supposed to know going into a relationship, this is how it was supposed to be done? I had to learn through trial and error, through failure, through my trials and tribulations, not only trying to find out who I am, but also trying to support a beautiful woman and who she is. No one sat me down. And a lot of our people go through that, and we focus on the failures and not the successes. We ridicule them and don't try to correct them. We make them feel bad for the things that they didn't know about. So then there's a lot of hurt and blame that comes from who? Yourself. We will talk to ourselves so negative, we will tear our own self down more than anybody else, even when someone's there supporting you, believing in you. You go back to that mirror and you look at yourself and you're like, I'm such a failure. But you have the whole world saying you're not a failure, you're beautiful, you're great, you're successful, it's okay, you're going to get through this. And you look at yourself in the mirror, you're like, I can't get through today. You're beating yourself up based off of what? Based off of the modeling, the definitions, what is it based off of? We don't know. That's your world. And the reason a lot of this kind of came to me, because at one time, I was doing a comedy show. And it was in Northern Cheyenne, and these, it was a good little crowd, but there's like 3 or 4 seats kind of like right in the front, like 3 or 4 rows back. And it was just kind of open. And these 3 older ladies come in. They must have not been doing good at the casino, okay? So they come in late. And they sat down. And I'm a grandma's boy. So I really wanted to like make them laugh. It was going to be really rewarding if I made these old ladies laugh, So I really I focused, trying to throw my energy to them. And they just kind of like, that's all they did. They were like, ah, and like laughing hysterically. After the show got done, shaking hands, thank you for coming to the show, thank you so much, appreciate you, blah, blah, blah. And all of a sudden, I seen this at the corner of my eye, those 3 old ladies, they were heading out. And I remember this old lady, she stopped. She stopped and she turned. And I'm like, oh, this old lady's coming this way. And I'm like shaking hands, like, thank you. And I notice her. And old lady shuffle, right? Old lady shuffle is the cutest, right? Just little. And I'm just like, about 5 people went by and she's still shuffling, And she's walking towards me. She's really old school, She had a muumuu dress with a belt, scarf, high-top moccasins, just really old school. And she came up to me, and she held my hand, and I just melted, because there's this old little brown lady, I'm a grandma's boy, just like, warm little shake there, And she looked up at me with her cataracts, right? And she said, can I tell you something? And I'm like, yeah, sure, tell me, whatever you want to tell me. And she looked up at me so lovingly, and she said, you're beautiful. And in my mind, I was like, shit. You can't handle this, Grandma. I just didn't say that. I didn't say that. But I said, oh my gosh, thank you so much. I really appreciate it. And I headed out. And I, gave her a hug and stuff. But what was weird is I've never been called beautiful. And when that old lady called me beautiful, man, it felt weird. Man, it was hard to accept. The trees are beautiful. The women are beautiful. The little deer walking through the forest is beautiful. All those things are beautiful. But a man, me, being beautiful, no one's ever called me beautiful before. How do I accept that? How do I take that? I can't. That's just weird, right? I got up to my hotel room and I got done, getting ready for bed and brushing my teeth. And there was this, those big hotel mirrors, they're just really long. You got the two sinks. And so I'm like, and we all do it. Don't say you don't do it, but we all do it. Don't even say. As you're walking down this long mirror, you look at yourself, Yeah. And you're about to shut off the light, right? You're about to shut off the light, and you take that one last look like, right? But something stopped me, and it's like, what? And the self was looking back at self, me, and I was like, what do you mean, what? Well, you should say it. Say what? What that old lady told you. I am not saying that. I am not going to say. You say it. I mean, no, I'm not going to say it. You say it. No, you say it. Well, okay, at the count of 3, we'll both say it. Okay, right? So me and self said it. On the count of 3, we'll both say it. 1, 2, 3. You're beautiful. I couldn't even look at myself in the eyes and tell me that I was beautiful. I went, you're beautiful. Hey, right? Really nervous, I was like, no, say it to yourself like you mean it. Look, you're beautiful. Right? Say it again. Say it again. You're beautiful. Nope, say it again, right? I went over and over until probably, 20, 30 times, right? And eventually, I calmed my nerves. And I allowed myself to just really, truly look at myself and say, you're beautiful. And I remember how the tear ducts would start kind of filling up. Something was going to happen. I don't know what was going to happen. My lips started quivering. And something was going to happen, something monumental. I didn't know how it was. Man, something's happening. Like, what's going on? Like, holy man, okay, just say it. Why is it so hard to say it, Just say it, Case. And I really had to do the goo-goo gaga to myself, really. Like, goo-goo, be kind to yourself. Be gentle with yourself. Believe in yourself. So I said it. And as I said it, my tears were welling up, and I said, you're beautiful. Just really, sincerely, wholeheartedly felt it. And I shook my head, yeah. I said, I am. I shut off the light, laid in bed, and I repeated that. I'm beautiful, I'm beautiful, I'm beautiful, I'm beautiful, until it felt normal. Until I fully could accept it. I woke up. Guess what I said? Well, eyes opened up. I'm beautiful. I walked through the whole day. I'm beautiful. You're beautiful. I'm beautiful. You're beautiful. You're beautiful. It was something where I had to really say something until I believed it. And there's a supplement I like everybody to take with them before, these 2 days of conference is over. There's a supplement I like you guys to take. It's called BHC. BHC. Oh, I never take this. Does it make you big? No. Oh, it could. I don't know. BHC. The first one, B, is for belief. Something I struggled with in my life. To believe in myself. I averaged 24 points, 5 3-pointers a game, but I still didn't believe in myself to play college basketball. I had a great relationship, 2 of them, and I didn't believe that I was good enough for that relationship. There's a lot of things I didn't believe in myself, so I came up with this acronym, BHC, the supplement BHC. When you wake up in the morning, believe in yourself. Believe in wholeheartedly who you are, and knowing that all your trials and tribulations do not take away from you, but they give you something. They strengthen you. Believe that. Believe who you are. You are beautiful. You are great. You are awesome. You are successful. You are prosperous. You're a healer. You're a hard worker. You're everything that you possibly positively can put in your brain. That's what you are. Believe that. And don't let anybody else come into your life saying that you're not. Because then that's where the self-esteem, self-confidence kind of comes in. Like, okay, what do I need to strength? But believe that you can heal. Believe that you can be a better person than you were yesterday. believe, because I had to believe that is beautiful, and that's where it all started. I am beautiful. You're beautiful. You're beautiful. The young man with the red headband is beautiful. These men right here are beautiful. These ladies right here are beautiful. And in their minds, they're probably saying, heck yeah, I am. Hey, right? Yeah. But don't ever let anybody come and say you're ugly, and then you start believing that you're ugly. Because once you believe something and wholeheartedly accept that, nothing can take you off of that at all. Remember that. You're beautiful. Believe that. Believe. Belief is so strong. Next one is honesty. BH. H is honesty. Don't kid yourself. I'm not talking about being honest with somebody else. I'm talking about being honest with yourself, or with anybody else, but with yourself. Being honest with yourself. You sit in the mirror, or you're sitting there and you're asking yourself these questions, am I as healthy as I possibly can be? Don't fool yourself. Are you or are you not? Because once you're honest with yourself, then you can start working on yourself on the things that you're wanting to improve, or the things that you see in yourself that can be better in your life. Be honest with yourself. Are you the best person you could possibly be today? Do you accept yourself for all that you are in this moment? Or do you think about a negative aspect on your mind, your spirit, your body? Remember, even your body, I know a lot of people are not honest with themselves, or they don't believe in themselves, even with their own body physically, because this is the only body you're ever going to have. And you're in a vulnerable situation when after your shower. And this is who you are. This is the human being that you are. This is the only body that you're going to have. And to look at yourself and say, no! Accept that body. Even if you're not happy with it in that moment, accept that body. Be honest with yourself. Okay, I could tighten up this part. I could increase the biceps on this part, or whatever it may be that you feel like you deserve. If you deserve more, be honest with yourself. How is that going to play out for yourself? Atomic Habits. You ever read that one? Who all read Atomic Habits? Little small incremental changes, right? One of the things, the little practices, and I just say is if you want to start working out, start with one step. Don't go run your mile. Just start with that one step. Then the next day, 2 steps. Or you could do 1 step for a week, whatever it may be. You're trying to create this habit, this beneficial, this positive habit. And the crazy thing is you want to start lifting or go to the gym, get through the doors and then walk out the doors. Get through the doors for a week and then walk out. Don't do any lifting. You want to start lifting, the hardest part is getting through those doors and then walk out the doors. For a week, let's say. And then the next week, go in there and do 1 rep on each arm, and then walk out. Then come back in. Your body's naturally going to want to lift more, but try to fight that urge, because you're trying to create a positive habit incrementally. Because what happens, I want to run a mile, you end up running 3 miles, and when you're 3 miles, what happens? Oh, I'm too sorry to get up to run another mile, right? Atomic Habits. Be honest with yourself. How are you going to get to that change to become better than you were yesterday? Okay? We all deserve to be honest with ourselves. Sometimes I can look at your eyes and I'm like, she's not as happy as she could be. I know what's going on. When we look at our clients or the people we work with, what's going on there? What's going on? I see it. We can feel the energy, right? Last one, BH, belief, honesty. Last one is consistency. Be consistent, being consistent. Okay? If you want to change your life or change your body or change your thinking, be consistent with what you want to change. Be consistent in that. And obviously, consistency builds discipline, but we're not going to get to discipline right now. But consistency. Be consistent in that. If you want to feel better about yourself, and this is something I said to myself, I want to believe that I'm beautiful. I want to know that I want to feel it. So I have to consistently tell myself every day, even still today when I wake up, I'm healthy, I'm happy, I'm loved, I'm beautiful, I am prosperous. Some of the words I say every day. When I'm running and I feel like quitting, I love running. But some days you don't feel like running, but you're going to run anyways. And man, that hill, I I just want to walk. No, you're healthy, you're happy, you're awesome. You're healthy, you're happy, you're loved. And then my mind switches. All right, I am. And next thing you know, I'm on top of the hill. Woohoo! Here we go, right? Consistent. Be consistent in your actions. Be consistent with your positive words. Just like it can work positively, it can also work negatively. For years, I beat myself up. For years, I didn't believe in myself. For years, I was dishonest with myself. For years, I was inconsistent. It was crazy how my life was unfolding the way I didn't want it to happen. It was scary. Because you know what? At the end of the day, I realized the only person that had any control of my life was myself. No one else did. No one else is getting me up in the morning and getting me to the gym. No one else is getting me up and telling me to write more jokes. No one was getting me up to tell me that you need to improve on your motivational speaking skills. No one was telling me that. I was telling myself that. I had to tell myself that I deserve this. Yeah, you get the affirmations from other people, but it doesn't mean diddly squat until you tell yourself that. Look at yourself in the mirror today, even at lunch or before you go to bed or when you wake up in the morning. And tell yourself 3 positive things. We always hear about this. But we want people out there to change their lives. We're helping people to say, get over that depression. Not get over, but get help with that depression. Get help with this suicidal ideation. But then at the same time, what are we doing for ourselves? Are we practicing what we preach? We want them to unlearn something like that, but we know it's not plausible. It's not helpful. Because for years, that's how they've been thinking. For years, that's how they've been conditioned. For years, that's what they've been being modeled. So we go in and we're like, what are you thinking? What are you doing? Oh my gosh, no. It takes a lot of discipline, not only with them, but yourself. What are you doing for yourself? Because if you want them to become better, are you becoming better? That was a hard lesson that I had to understand. Going around doing motivational wellness education and realizing I wasn't using my full potential or my full understanding of what it meant to be. I'm going to do this really quick. I'm going to try to do it really quick. I got time. All right, so what I want right now is I want 10 people, volunteers, okay, to come on out. Don't be shy. It's not embarrassing. I'm not going to embarrass you. You might embarrass yourself, but I'm not going to embarrass you, okay? So 10 people, come on out. All right, there we go. Come on out. How about a round of applause for these? 1, 2, 3, 4, 5, 6. Come on, guys. 7, 8, 9. Come on, guys. It is girl power. Jeez. Well, as natives, the women, and even as in humankind, women are our backbone. So we will learn from you all. So create a circle. Create a circle. And maybe kind of shift over closer to the middle of the room. And I just want to make sure I don't... Now, this is going to be called... what you say? That's what it's called, okay? What you say? That's what it's called. This exercise is called What You Say, okay? Now, what I'm about to do and show you is a little bit of some neurological... what do you call it? Rewiring kind of thing. Okay? So what I want you to do is close your eyes. Okay? And then open them. Okay? Look left. Look right. Okay? In your mind's eye, or no, we'll do this one. We'll, everybody, if you're fine with it, hold hands. Okay? Now, close your eyes. Now feel how sweaty those palms are, how cold they are, how warm they are, how dry they are. Just feel them, okay? Sensationally, we're feeling it. We're being in the moment, okay? Now, reverse the way you're holding hands. Now, for some of you, it's comfortable. For some of y'all, it is, oh, shit, one just really crossed like that, okay? For some of you, it's unnatural or it just feels weird, okay? Just feel that sensation, even if it's accepting or if it's weird. Just feel it, okay? There it is. There it is. All right, cool. Now, drop your hands, open your eyes, okay? Now, all I want you to do in your mind is to say what I say. Okay? Say what I say. Step right. See how neurologically we are already conditioned? We are so conditioned we don't follow directions, right? Because why? I'm going to tell you why. Now, this is exactly what I'm talking about, the failure concept, the belief, the honesty, the consistency concept. We're trained and kind of programmed to do something without thinking because of what we believe and what we've seen. So we automatically will do something that we feel is right. Even though the instructions were not to do that, just to say what I say, okay? Okay, ready? Say what I say. Step back. Step back. Step forward. Step left. Step right. Hold up your right hand. No, really, hold up your right hand. Okay, you can stop repeating what I said. Taking it to extremes, right? Okay, no. Don't need to repeat anything what I say now, but just do what hold up your right hand. Hold up your right hand. Yep, hold up, yep, it's not a trick, yep. I just want to make sure everybody knows what's right, okay? Now hold up your left hand. Okay, here we go. What's point the direction of forward? Your own forward, yep. Okay, point in the direction of your own back. Like what's back? Okay, here we go. Now you're going to do what I say, but not say what I say. Okay? You're going to do what I say, but not say what I say. Do what I say, but not say what I say. Step right. Step left. Step forward. Step back. Round of applause. Round of applause. Yes. Their social conditioning is working. I love it. Right on. Okay? Now, here we go. I just want to make sure I get this right because I'm always getting blamed like, that's not what you said, okay? Okay, do what I say, but say the opposite. Do what I say, but say the opposite. Now remember, this is, for some of y'all, this is new. This is weird. Imagine you're telling somebody to change their life, to quit doing something they've always been told or done to cope or to believe or whatever. You're asking them to change because you know if you do it a certain way, it's going to benefit your life. If you're able to rewire and restructure your brain and think differently in a positive manner, it's going to benefit your life. And I'll show you, I'll tell you more about this example here. Ready? Do what I say, but say the opposite. Oh, your brains are just up firing right now. I just smell cooking. Just cooking up here. Ready? Do what I say, but say the opposite. Step right. Yep. Say, do what I say, but say the opposite. Step right. Do what I say, but say the opposite. Step right. Do what I say, but say the opposite. Step right. Step right. Step right. Step right. Step right. Step right. Now we're priming the neural, there's a fighter here. That's all right. That's all right. Okay, now we're going to go back the other way. I'm priming you. Step left. There you go. Step left. Step left. Step right. Oh, step back. Okay, it's good. That's right. Okay? Okay, we'll do it again. Step right. So the brain's fighting. Step right. There you go. Step right. Step right. Step right. Step back. All right, now as you see what's happening is the brain loves patterns and it loves predictions. It loves to know what it's going to do. But as soon as you hit it with something that's opposite, it struggles like, what are you doing, right? It's called your brain is able to rewire if you're able to fire different neural networks. So all we're doing is we're trying to rewire the brain a tad. And when you do this, something different, you guys ever walk on the curb like when you were a kid? You walk on the little ledge wall or whatever and you walk? When you were a kid, I don't know how many of y'all did that, but that actually was found to actually fight Alzheimer's. because you're doing something. You're using your brain in a different way because we walk like this, right? But then you switch it, now you're like thinking and you're concentrating and you're using your brain. That's exactly what we're doing right here. We're using our brain. We're cooking right now, okay? So do what I say, but say the opposite. Step back. Do what I say, but say the opposite. That's right. Step back. Again, we think about addictions, we think about people with mental health disorders, or we think about people that are having a hard time with anxiety or depression. We're asking them to change. This is what they're going through. They've known something to deal with and cope with something so many times in their lives, and we ask them to change. It's hard for them. Even for us as healthy individuals, it's hard for us. Imagine what they're going through. Step back. Yep, step back. Step forward. Step forward. Step forward. Step left. You'll get it. That's good. I'm never going to dance with any of you. Hey, right? Step left. Step left. Step left. Step right. Give them a round of applause. Give them a round of applause. Yes. Tell them, say it to them, you can do it. 1, 2, 3. Tell them you are worthy. Say, we love you. Even if you don't, say, we love you. Yay, okay, because this next one's going to be real hard. And this exercise we can go on forever, but we're not going to. Okay? The next one is say what I say, but do the opposite of what I say. Say what I say, but do the opposite of what I say. Ready? Say what I say, but do the opposite of what I say. Okay, ready? Step right. Yep. Oh, that's pretty good. Step right. So you're stepping left, but saying step right. Okay? Step right. See, the brain fights, right? The brain fights it, right? No. How many stubborn people do we know in our lives? No, I'm not changing. Okay? Step right. Step right. I haven't changed it at all. That's in your brain. That's in your mind. Step right. Step right. Step right. Watch this. I'm going to step back. Oh. Okay, remember, say what I say, but do the opposite of what I say, right? Oh, geez, what is going on? Oh. All right, showtime. What I was going to, I don't know what's going on. Anyways, I didn't do that. I don't know. Light? Oh, there we go. All right. We'll do a couple more times. We're going to go step left. You're stepping right, but saying step left. I'll give you that. I'll cheat for you, okay? Step right. Okay? One more. Step back. There you go, yeah. Now step forward. Step forward. There you go, step forward. There you go, step forward. Step forward. Give them a round of applause. Give them a round of applause. Good job, ladies. Thank you so much. You guys can have your seats. Take your seats. Now, if anybody's working with youth or working with addictions or groups, I encourage you guys to do that exercise with them because it really will help them understand how hard it is to change. It puts it into a physical sense, but also into a mental, emotional I did this with a group of addicts, and they literally got mad at me like I was the one to blame. Like, it's your fault. I'm like, no, it's not my fault. I'm just telling you directions. And they really got really emotional. So again, as a group, we sit them down, we process it, what's so hard about it, what's going on, and a lot of it is the change part. You're telling me to do something that I don't understand. You didn't coach me. You didn't show me. You didn't model me. A lot of those addicts are saying that. I don't know what you're wanting from me. And their brain will literally just shut down and they'll go back to what is normal for them. My very last one in terms of that exercise, send us off into lunch. Okay? is moved. Okay? Something has moved you to become who you are today. Each and every one of you. Something has moved you to become who you are today. Period. In a negative way, in a positive way, something has moved you. I don't know what that is. That's your story. That is your story to share or to draw strength from or to be weakened from. It is your story. Something has moved you to become who you are today. And I told you just a little bit about what has moved me today. And I take all of it as a blessing because I'm still here today. I'm still breathing. I'm still trying to live. I'm still trying to teach my kids, my nephews, my nieces. I'm still trying to teach different communities and different organizations about what has moved me. And I take pride in that, even in my failures, even my struggles, my trials and tribulations. I take pride in that. Each and every day I'm trying to become better than I was yesterday because something has moved me to become that. M is for motivation. What is your motivation? I'm not going to go too much into motivation, but what is your motivation? What is your motivation as you get up here today, go to lunch, or you wake up in the morning, or you go off to whatever? What is your motivation? Ask yourself, what am I motivated by in life? What continues to get me up to do something? What are you motivated by? Are you motivated by your high blood pressure? Are you motivated by that youth that just committed suicide 2 weeks ago? What are you motivated by? And is that sustainable? Is that workable? Is that something that you can continue on with your life to continue to stay motivated in your job, in your health, in your spirituality, your mental, your emotional? Is that continuous, or do you have to keep implementing different things into your motivation? What motivates you? Really, that's a whole other presentation, but we're not going to get into it. The next one is openness. How open are you to life? How open are you to success? Because we know when we get success, we want to go right into self-sabotage because things cannot be this good. Nope. It's going too good. Something bad's going to happen. We self-sabotage it. How open are you to your failures? How many times have you gotten up when you fell? How many times have you gotten up from your seat and walked? Those little victories provide monumental thinking in your life. Openness. How open are you to success and failure? Next one, vision. Do you see yourself doing what you really ultimately want to do in life? Do you see it? When I'm on stage in comedy, even tonight, I'll do a little comedy show, but I see you all laughing. Now, if you all laugh, that's okay. If you don't laugh, cool, whatever. But what I see happening is what I want to happen. I see myself, let's say I want to bench 250. I see myself benching 250. I see myself squatting. Oh, yeah, I'm going to build those glutes, right? Whatever it may be. I see myself doing the thing that I want to do in life. Do you see yourself doing that? The next one is evolve. Not only are we motivated, not only are we open to it, and not only do we see it, but now we have to evolve into that human being that we know we can become. Quit trying to be like somebody else. Be you. You are a unique, beautiful, great individual. Be you. Quit being like everybody else. Be you. Evolve into that human being that you know you can become, greater than you were yesterday. That's evolve. Last one is discipline. You want to stay moved, or you want to be continued to be moved, whatever it may be, become disciplined. You want to become more prosperous? Be disciplined. Learn about financial literacy. Learn about what brings in money. Learn about that. Be disciplined in that. If you want to lose weight, be disciplined in that. You have one body, one life. You deserve a great, healthy life. Be disciplined in that. You want to become smarter. You want to become a supervisor and tell A, B, and C, D, other things. Like, I've been told this whole life. I'm tired of being told. I want to tell other people, okay? Be disciplined. Figure it out. Discipline is so powerful. And there's a quote where, I know, so many motivational you're going to do something even though you don't want to do it. Waking up at 6 o'clock in the morning, 5 o'clock in the morning, and you know you've been on the streak of running 3 miles or whatever, and it's raining, it's cold, and your body says, nope. But discipline says, yep. Let's go do it. Let's get this. So remember, as you kind of walk through life and reflect on my story or whatever story has generated into your mind and your heart, remember to stay moved. Whatever has moved you, allow that to carry you through because you are a beautiful people. You're there helping people that are struggling right now in life. Maybe you're struggling in life right now. Use some of these words that are shared at this conference and these stories that are shared at this conference to empower you, to strengthen you, to get you through the next day, to motivate you to become better than you were yesterday. I'm not perfect. I don't claim to know anybody or be better than anybody. Everything I have taught has been from my education, from my elders, from my experiences. All this stuff I've never made up. This is stories that I've shared because of my experiences. And I want to say thank you so much for listening to a small part of my life, a small part of my motivational talking. And I appreciate each and every one of you. I love you, and I wish you nothing but the best. Thank you guys so much. Yay! Woo! And Donnie, right back to you.
Thank you, Casey. How y'all liking it so far? All right. So when y'all registered this morning, y'all probably noticed that there's a QR code on your badge. So that is for our evaluation to see how we're doing. Plus, we like to collect data. So our funding agencies, SAMHSA, state, all like data. We like data. So if you will, to have the opportunity to scan that QR code, take an opportunity to fill out the data or look at that, I'd appreciate it. We're going to break for lunch. I'd like to thank y'all for participating and showing up. Come back here at 1 o'clock. We have this afternoon full of stuff, and we'll have some more information. Those that are going to stay for the evening gourd dance, there will be a meal that's going to be served. We'll be passing out tickets for the evening meal. For those that are going to stay for that, we'll announce what time to pick up the tickets for the meal at the registration desk. So you're not obligated to stay for the meal, but if you'd like to join us for the meal, feel free to stop by and pick up a ticket. Probably be after the break sometime this afternoon. So, but you will have to have a ticket for the meal during the comedy show and before the gourd dance. So that's it. Break for lunch.
or if you know anybody out there kind of lollygagging, or maybe they fell asleep in their room or whatever not, invite them back. Bring them back. We're ready to come back to our afternoon session. We have a lot of things planned today, a lot of panel discussions, a lot of awesome presentations. Also, I want to remind you all, don't forget about our event tonight. We are going to be doing a small, or a dinner and a comedy show for the hour. I'm believing we'll let you know when to grab those tickets or where to grab those tickets for the dinner tonight. And then also from 7:30 to 9:30, we're going to do a traditional gourd dance that we are inviting you to come to be a part of as well. Those are our evening activities here at the Oklahoma 988 Tribal Mental Health Summit. Yeah, how's everybody doing? Are we all doing good? Do we got the itis? Do we have the itis? Like, yeah, ate a good lunch and now we're all kind of, right? That's good though, that's all right. We're gonna be going into our next set of speakers, and the only thing we ask respectfully, give them your best attention, participate, ask questions, again, same thing, set the intentions of being open-hearted, open-minded, set your intentions of focus, and come here to learn from our various different speakers that we have today. So please do that in a good way like that. And with that, we will get started. We want to try to keep on schedule as best as we can. This next portion, to start off our afternoon portion, is a spotlight on tribes. And I believe we are welcoming these individuals up. From the Cheyenne and Arapaho Nation, Zach Black Owl and Rosanna Tallbear. Yay! We're just going to keep bringing them up, and we'll bring chairs up here. From the Cherokee Nation, Kristen Riles. Right on. The Muskogee Nation, Meredith Razor. Comanche Nation, Blake Mosley. Hola. And Southern Plains Tribal Health Board, Stephanie Hawk. Corey's going to grab some more chairs. Where's Stephanie at? Oh, there she is. Right on, Stephanie. Oh, you're not Stephanie. You're somebody else. You're a replacement. All right, we'll get your name up here. She's like, yep. Come on over here, a.k.a. Stephanie. I just want to get your name right. Mary Kate Helg. Yay! Right on. All right, and I'm going to give it to you. We're just going to go down the list here. So first and foremost, we're going to start with Zach. We're going to Cheyenne and Arapaho Nations, and then from there, we'll kind of just go with the flow and see where it goes. Oh, cordless mic.
Good afternoon. Kind of nervous up here, but we'll get through this. I hope everyone enjoyed their lunch, because I know I didn't. I had to rush over here. But anyways, we're from the Cheyenne Arapaho Tribe, the 988 Tribal Response Program. My name is Rosanna Tallbear. I'm a member of the Cheyenne Arapaho Tribes and also of the Absaliga Nation. And what we do, we're talking about community engagement. And we go out into the community and we plan all these events, and we also work with our prevention program, which is traditional addiction and suicide prevention. And I have our coordinator, our boss, our supervisor here, Katie Williams Sullivan. She's here too. And we also have Zach is the outreach person, and also have our mental health specialist, which is Christina Sharp. What we do out in the communities, we plan all these events. I'm kind of new at this mental health. When I applied, I didn't really apply for this position, but when they said, this will be a good fit for you. And I was like, I guess I'll try it. And so I've been learning every day. Everything's new, which I'm happy for it, because this is what I want for our people. Not just my tribe, but everybody else's tribe and the community. But let's see. We plan these outreaches. We have, in our communities, we have these emergency response in each community. And we try to focus on different things. Like our recent one in October was our Elders Mental Health Awareness Day. And we all planned, and with my team, and we talked about it, and we said, well, these elders, I know I talked to some of the elders, our elders, and when they say mental health, you know what they do? They say, I don't want to go to Norman. Don't take me. But we're trying to change that and getting this number out, because I know a lot of them raise their grandkids. And just getting this number out, 988 Mental Health Lifeline, getting it out to the people, to have them understand, have them find resources, not for themselves, but their families. And that's what we do. We try to get this out there. And hold on. Sorry. Slide. Okay. What does community outreach planning and organization looks like? Well, we have our social media, and I heard we're TikTok famous. And Zach will go into details about that. And we build relationships, and we all work together. We're all on a community, on a Zoom, everything, and we work well with our partners and everybody through the state, and also with Josh. He's like the main organizer. But what I like to talk about is we have our community advisors, like our cultural advisors, and some people, I know when you say you need help, they won't go, but we have this other way you can go if you need help. And we have our cultural advisors, and what we do, we pick people out in our communities that go through, that are well respected in the community. And what we do is, if somebody needs our help, if they want to go through our traditional ways, we can show them that way, that route. And we're trying to do a cultural day this month, November 29th is our cultural day. And I'm getting all our cultural advisors together so they can tell us what they do, how to go through mental health, or what they, all the prayers. I know prayers help. And I know all our traditional beliefs, they help. If people don't want to go the professional way, they can maybe go through the cultural way. But I'm going to turn it over to Zach, and he'll continue this. Thank you.
All right, good afternoon. Thank you, Rosie. And like she said, we love to partner with anybody and everybody, whether it's another mental health organization, or it's a opioid response organization, or if it's another tribe or a third party or a State Department. We do not discriminate who we want to do business with or services with, because we know there are different types of services out there that our people need to know. And that's kind of what this whole outreach and our community engagement was about. We just want to create a place and a safe space where people can come and learn about these things, and learn about the different services, learn about the different resources that are out there that are available to them. Because a lot of times they don't know. That's what we run into. They didn't know that 988 was a thing, or they didn't know that ODMHS had a vending machine with Narcan, and then they find out at these things. So with all that being said, well, I want to touch on, too, the tribal advisor part. That is a unique part that we are currently love to promote out there. We got a roster of different tribal elders, women and men, who are essentially traditional spiritual leaders in the communities, in our tribal communities in northwestern Oklahoma. They know the old practices, they know the old songs, they know the old healing ways, and so we reached out to them and asked them if they would offer that type of service to the people who aren't looking to get involved with, a more structured mental health facility. They just want to learn more about their culture. They want to pray. They need a song. They want to go to a sweat. Different things that's offered. And that's one part that we love to promote out there too. So all that being said, our community outreach planning organizing, we tried to break it up into 4 different parts. First one is, social media. Our social media and public relations opportunities, which I have to give a shout out to ODMHSAS for our public relations opportunities. We have been able to write articles in newspapers. We have been able to share different resources with different news outlets, and I can wholeheartedly say that that would not have even been possible if it wasn't for ODMHSAS on that. So shout out to Bonnie if she's in here. I don't know if she is. She might be outside still, but yeah, thank you, Bonnie, for all that. And our social media, we target our social media. We have 3 different social media pages that we go through. We have Instagram, Facebook, and TikTok, which we'll get into more in the slides after this. But even with our social media, we we get our messages out, we post our event flyers and our content from outreach events, and we just try to share that, and we try to show people, like, you can come find community, you can come find different things at our events that we have. Another thing that we have is, our outreach events with targeted messages. So we have different outreach events through our communities, whether it's a culture class, and that's something that we learned to take from our traditional addiction program that we work with. We had a mental health youth summit that was organized by our director, Katie Sullivan Williams over there. We have bingo, singo night. I don't know if you guys have ever played singo. It's basically just like a music bingo. We try to incorporate how music can help you with your mental health. And we also had an open mic night, which was really, really good turnout. We had over 60 people come out to that, and that was in El Reno. And we kind of just created a platform. We partnered with a mental health organization called Gen Y, and they're real good partners with us on getting messages and spreading mental health messages out there. So outreach events and targeted messages. We try to provide door prizes, incentives, and food. I know that's one big thing that sometimes funding doesn't allow us to do, but we find a way, whether it's going to a tribal leader asking for a donation or going to another organization ask if they would provide that can buy that. So we know in our culture, if we're asking people to come to our events, we need to provide something in return. And food, prizes, incentives, whatever it may be, that's our way of doing that. So that's another way that we get a lot of engagement as well. Another thing is relationship building. Our relationship building is a part of our success. We have made multiple different relationships with different mental health organizations, from tribes, from the state, from the federal level, to private businesses, to schools, to different things throughout the time we've been in program since March 2023. We've hosted a staff development day with our own tribal headquarters for the Department of Administration. And we also create MOUs with our behavioral health facilities or any other one we have to do. It's just to show, because we know that's required, MOUs. We know that's required. So we get that out there. And then speaking engagements and sharing our own stories. Like you heard me this morning, I shared my own story. I usually do that. I'm able to do that at all our events. This morning it was kind of a lot more of you in here, obviously, but when I do it at our communities, it's probably about 10 to 20, 30, 40 people. So it gets more intuitive and we get more close. But yeah, we broke it up into 4 different categories, so different things. That's what our community outreach and engagement looks like, and that's how we begin to start it. And with that, we just try to be creative in how we put 988 in there, how we put mental health messages in there, and how we put positive and different things in our outreach events. So if I go to the next slide, I don't know if this little clicker will work over here. I think Dawn gave me a dead one. Oh, There we go. All right, so here's our Instagram page. You guys can follow us anytime. We have an Instagram page. Our name is 988 Tribal CA. We have, as of right now, I know we had over 200 followers. We've had over 67 posts, and then our Facebook page right next to it. Those are just different social media pages that we utilize and use, as a way to get community engagement and to post events and messages and flyers and different things. And let me see if this next one is one of my favorites, because I actually had another program tell us that we were TikTok famous. And to me, TikTok was a whole nother thing to me when I first got on it. I listened to my nieces and nephews, all the little kids and the youth that use it. So I decided to make a page for us, and then it just turned into something that we were able to share, to record videos, to show highlights, and that is something that we are very proud to share with everyone, like how it goes out of our events. And I don't know if it'll let you play the video on here, Dawn. Does it show a video? Will it let it play? I don't think so. Well, if you ever get on TikTok, I wanted to show you guys those videos, but this one on the left is our Mental Health Youth Summit, and we just partnered with our media specialist for nutrition addiction, and he just created a highlight video of the different things that we did throughout the day with the speakers, with the activities. The one on the middle, we actually had a color run in September in observance of Suicide Awareness Month, and we were able to have over 160 individuals come out to that in El Reno. And the last one on the right, I believe, me and Rosie actually got to partner with our Cheyenne Arapaho Youth Council, and we were able to be chaperones for a youth trip to Unity, the Unity Leadership Conference that all of our Native youth go to. And let me tell you, I've never been tested in my life so hard listening to teenagers, but it was a great time, to see kids come together and do that. And while we were there, me and Rosie were able to share, stuff about 988 and give them information and about mental health and all that. So that worked out. And then we have pictures of our outreach activities events. Up there on the left is me and Christina with our youth council at a youth council meeting doing a self-care activity. On the right is me, Rosie, Katie, and Christina at our Overdose Awareness Day that was put on by our tour program. And this bottom left picture right here, you can see we're all wearing green. We actually put out a challenge for this on May 17th, I believe. It was Wear Green Day for Mental Health Awareness Month. We had our whole tribe involved, and everybody wore green that day. And we had everybody send in a picture through email or phone. If they wore green, they were entered in a drawing. So that day, we got to spread awareness about mental health in 988 as well. And then in the middle, you can see, I think I got beat, but Rosie was the referee for a rock, paper, scissors match with a kid at an event, and I lost. So on the right is a culture class, is a moccasin making event. And ever since I took that class, I now know and appreciate why moccasins cost so much, because that was really one of the hardest things to make. And then we keep going. When we were there, yeah, I kind of went over all these already, our public relationship building, our public relations opportunities that we've done, and our speaking engagements. Here we go right here. Yeah, we spoke at different things. There's Rosie speaking, there's Christina speaking at Men's Health Day. And the top right, I actually wrote a letter to the editor for the El Reno Tribune in our local community. And on the bottom right is where I actually shared my 988 story with News Channel 4, and that aired last month sometime. So we consider ourselves to be hard at it. We're always an event. I think we had over 20 outreach events last month in October. So that just let me know that I was away from the office more than I should have been, not working on my reports. So, and then our next one is our team. I'll get to the end here, I promise. Yeah, this is Rosie Tallbear is our project coordinator, Christina Sharp, our mental health specialist. There's me, community outreach specialist, and Rachel Curtis, our administrative assistant. And it's us, but we have a whole division of prevention programs that we work with. Like she said, traditional addiction, Native connections. We all work together, we team up, do different things. It's like the camaraderie in our office. I wish you guys could come see it, the way we all just tackle different events for each other. And with that, I think I'm at the end of this now. Yeah, so I want to thank you guys for your time. If you have any questions, me and Rosie will be right over here sitting. We'll be over our time. And if you have any questions about how we do our community engagements, and I know we kind of rushed through that, but it's real cathartic and real healing for me to be able to out in the community to do this. So I want to thank you guys for your time today, and I'll go and pass it over to the next one. Thank you.
So that will click. Hi, I'm Kristen Riles. I'm a slide reader. I am with Cherokee Nation. I'm from Tahlequah, Oklahoma, and I am new to, well, I'm not really new. I'm returning employee to Cherokee Nation. I've been back for about a month now, and I am the project director of our Tribal Response 988 grant. So just a little history about the Tribal Response 988 grant. Cherokee Nation Public Health Department originally applied for the grant and received it in December of 2022. We took it over, Behavioral Health took it over just this past month. So part of our team is me for right now. We're gonna be hiring two more positions, so hopefully that will happen really soon so we can jump in and get started. Our service area, of course, is the 14-county jurisdiction within a reservation. Extends from Tulsa, Oklahoma, to Arkansas, Missouri borders, and up to Kansas. Kind of going fast because I'm kind of nervous, like Rosie said. We didn't get to eat our lunch. So our goals and objectives, we want to work with tribal health, public health, service providers, crisis call centers, community providers, on best practices for crisis support services. We also want to enhance our systems to ensure navigation and follow-up care, establishing a written protocol with 988 regional office call centers for receiving referrals. Of course, establish a referral improvement work group within the Cherokee Nation, and improve our rate of successful linkages for individuals referred by 988 call centers. We also want to enhance collaborations with the following people, of course, tribal, state, and territory health providers, law enforcement, and other first responders, and improve our rate of successful linkages for individuals referred by 988 call centers. So, like I said, I'm new, returning new, so this is all about those service providers we already have connections with and strengthen them and make new connections as well. We're really excited to work with SAMHSA GPO and the Tribal Response 988 work group that Rosie mentioned when she talked. So it's a good group of people, and I'm looking forward to working with them. I'm going to be here today. So if you have any questions, please feel free to holler at me.
All right. My name's Meredith Racer, and I'm with Muskogee Creek Nation Behavioral Health. I'm the project director for our 988 Tribal Response Grant. I've been with Muskogee Nation for about 4.5 years. Like everyone else, that we were awarded this grant back in December. I kind of took over as project director, I think it was March, and then just a couple months ago, we hired a case manager, Angie. She's here today. And she actually just last week completed the courses to take her certification test as a behavioral health case manager, and our phone number for 988 went live just last week. So that was that was the biggest excitement so far. That seems like it's been a lot building up to that, so I'm really excited to finally have that number live and ready to take calls from Solari. Right now, since we just have the one staff, our hours are 8 to 5, but our hope is to eventually extend that into 24/7 coverage. So, hopefully in the future we'll have some more staff hired. Like I said, I'm just work on the R988 project, but as far as behavioral health in general, we have a lot of programs that are funded by SAMHSA and IHS grants. Zach was talking a lot about community, and I think that's kind of been one of my favorite things working for Muskogee Nation. Besides, being in the office helping people, we do a lot of community events, and that's my favorite part. I love going out, doing things in the community. For example, like in the summers, we do family fun days. Each Friday in a different community. We have lunch, invite families in the area to come out. We have games for kids, resources, to offer the parents over, parenting, mental health resources we have available. We also have a Native Connections grant, and they do a lot of stuff in schools. One of our other grant programs has set up Hope Squads in a couple of our schools, and I think we have someone tomorrow doing a presentation over Hope Squads, so we'll kind of learn more about those. That's really it. I'm going to try and keep it short because I know we're running short on time.
Hello, my name is Blake Mosley, and I am with Comanche Nation Prevention and Recovery. Our 988 falls under our Prevention and Recovery Department. I am the project director for it. I'm also a team of one at the moment, but we're working on that. But prevention and recovery in general is one of the bigger departments within Comanche Nation. We have about 40 staff, and that's split up between our inpatient and our outpatient. Our inpatient specifically is for Native men and women. We can house 12 men and 5 women. They're located out like toward Medicine Park where the complex is. It's a 12-month treatment program. A lot of the people that we get in to our inpatient treatment come from our reintegration or reentry programs. That are also housed out there. Our outpatient has multiple programs. We're all grants there. We service the whole community, so whether you're Native or not, you can utilize our services. We do mental health assessments, relapse prevention programs, parenting classes, batters intervention program. We provide financial assistance for counseling services through our Native Spirit Project. We also provide referrals and inpatient treatment for inpatient treatment and for behavioral health. So if we can't find you somebody here, we will find somebody for you somewhere, whether it's inside our district, our jurisdiction or not. And then we also provide referrals for DUI classes. Comanche tribal members get their assessments and their classes paid for. If you are a federally recognized tribal member, you get your assessment paid for if we have the funding for it at the time. We have 988, Native Spirit. We have an I Am Indian program that focuses specific on youth prevention for drug and alcohol use. Native Spirit is also our suicide prevention, intervention, and postvention. I did it, Candace. I think that's all of them. Is that everybody? Head nods over there, Comanches. Yes, no, maybe. Martin, gotcha. Cool. I think that's everything. We do a wide range of services. Our catchment area is Comanche, Kiowa, Tillman, and Cotton counties, and then portions of Caddo, Grady, Stevens, and Jefferson. So we intermingle with a lot of these people in the southwest area and partner with them and do a lot of programming and stuff together. And I think that's all I have.
Hey everybody, I'm Mary Kate Haug, and I am with the Southern Plains Tribal Health Board. I do have a presentation I think Dawn is pulling up. There it is. So like I said, I'm with Southern Plains Tribal Health Board. We're kind of a unique grantee in the sense that we are not a tribal nation, and our service area is the entire state of Oklahoma. So our goal is to work with the other grantees to facilitate communication within that group and to help with referrals, handing off to them, to their grantees in their service area, and then help those tribes that do not have a 988 grant to help them with referrals and getting them the resources they need as well. So this is our team. I'm the first one. Stephanie Hawk is one of our peers. She's here today too. And Cassandra Frazier as well is another peer. So quickly, just some of our goals is to provide and coordinate cultural competency, trauma-informed, and suicide prevention training for partners. Part of that is, I think Tony hit on it earlier, but we provide a cultural competency training to Solari, as well as to OK Ride Care, which I'll get into later. Obviously, increase awareness of 988, identify and reduce barriers to coordination of crisis care, discharge, and transportation, track referrals and screenings, reduce suicide, and establish those partnerships with our tribal and non-tribal partners, and obviously our 988 work group. One of the first things we did as a grant was conduct a rapid needs assessment, and that was done through our texting tree and through email. Next slide. We had 328 respondents. We had a nice mix of rural versus non-rural. And this kind of just helped inform our strategic planning process. So from that needs assessment, we found that 27% of respondents hadn't heard of 988. 35% weren't aware that Oklahoma had their own local call center. And then 41% of our Native respondents were unsure whether their tribe provided transportation to or from a behavioral health clinic. So this information just kind of gave us a baseline to start and fill in those gaps in the state that we thought needed addressing. Just like everybody else on the stage, we put a huge emphasis on outreach and community engagement. So part of that is our texting tree. We have a texting tree where messages go out every Monday at 10 a.m. And those are just quick messages related to mental health, self-care, 988 information, anything upcoming, events or community events. We put that in the texting tree, and you can sign up for that by texting HOPE to 55251. Forgot. Next slide. And then we try to get out to as many community events as possible, just like everybody else. We try to be at as many mental health events. We were just at an event at the Redlands Community College, and that some of these people were at as well. We were involved in the Out of Darkness walks in Oklahoma City, Tahlequah, Atoka, and Norman. And obviously this engagement serves to raise awareness of 988, increase social connectedness, and then provide tools and resources and assist with referrals. Some of the things that we've done so far is we have partnered with OK Ride Care. They're here today. They have a booth outside, so you should definitely check them out. They help to provide transportation to tribal members across the state, regardless of jurisdiction, to and from mental health services, so they're an amazing partner for us. We did conduct the rapid needs assessment, and we'll do something similar at the end of the grant to just compare their responses and see if we've made a dent. We've provided Solari and OK Ride Care with that cultural competency training for their employees. And we created a PSA that's being shown in rural movie theaters since rural respondents to our needs assessment were less likely to know about 988 and have fewer resources. I don't know if you can click on this or not, Dawn, but it's our PSA. Is that a no? No. Okay. Well, we'll try to show it to y'all later at some point. But it is really cool. It's in rural movie theaters as well as Harkins, I believe, downtown for a full 52 weeks. So hopefully you'll see it. And other than that, thank you so much. My email's up there as well as Stephanie and Cassandra. If you're a tribe that doesn't have a 988 grant, come and find me and let's talk.
All right, how about another round of applause for these individuals and the clicker. Thank you, clicker. You did an awesome job, all of you. Cheyenne, Arapaho Nation, Cherokee Nation, Muskogee, Comanche, and Southern Plains all seem to be doing a great job in their communities and their respective programs. Thank you guys so much. Moving on with the agenda, we're just going to get right into it. The SAMHSA presentation. Let's round of applause for Monica Johnson, yes, the director of the 988 and Behavioral Health Crisis Coordinating Office. And we look forward to hearing your awesome presentation.
Is it special rules for the clicker? There should be a presentation. I'll figure it out. Did they get lunch and I didn't too? All right, so while they're getting the presentation ready, thank you again. I'm happy to be back up here. We'll make this a little, hopefully I'll wake y'all up. I know some of you ate, some of you. Thank you to the panel that just presented. Part of being here for me is what I talked about this morning, of being able to see what happens locally in the communities with the federal funding that we are able to help infuse into communities across the country. So that was super informative for me personally, and I just want to thank you all for that. All right, there we go. All right, so again, for anyone that's just joining, I forgot we're being live streamed. I'm Monica Johnson, Director of SAMHSA's 988 Behavioral Health Crisis Coordinating Office. Again, I'm excited and proud to be here with you today to support tribal mental health. And just this collaboration that we're looking at and seeing today, the last panel was a clear demonstration of that as well. I need more room. So before we get started, I do want to just recognize that I have a team, and some of my team is here with us today and traveled here that I do want to recognize. So earlier I did point out Captain Harrod was here, so we shouted her out, but we have some more folks here from the SAMHSA administration as well as the 988 office within SAMHSA. So in no particular order, because all these people are fabulous, and if you don't get to say hi to them today, please try to do so tomorrow. They're all working very hard on behalf of the country. Carissa Palace, where did she go? She's our wonderful communications director for 988. She's worked very closely with the organizers of this event to bring us all together here in this way. Danny Bennett is somewhere being fabulous. She's our media director for SAMHSA. And then over here to the left, I have Jill Mays. She works in our 988 office as our division director for crisis transformation. We have Laura House, who is our coordinator for equity and engagement. And then last but absolutely not least is Tiffany Russell. She's our chief resident expert for all things 988 and justice systems collaborations. So the theme I want to pick up on before I jump into this presentation, Zach went after I had an opportunity to do my welcome comments this morning. So I just want to say publicly and out loud, thank you for the courage and the transparency and being vulnerable to share something that's so personal in a way that helps other people remember their why. You had my eyes acting up a little bit over there. I think it's allergies, I'm not sure, but you got to me, and I'm gonna never forget who you are, and we're always gonna remember you. So thank you, and just keep moving forward. Someone else said earlier today about remembering to take care of the people who are taking care of the people. And so I do want to shout out as a licensed professional counselor that we need to remember that people are doing this work of all walks of life. Some people volunteer to do this work. Some people are being paid less than what they would like to be paid, but they show up and continue to do this work. And it can be traumatizing and not taking care of yourself. Because just, you know, I know what you're facing and dealing with every day. So I just wanted to especially just thank Zach and everyone else and just give that reminder as well. And then one other thing, in just this moment of reflection about outreach, because that was the theme of the panel that preceded me, let me tell y'all how hard I'm out here in these streets working and trying to tell people about 988. It's gonna be a TMI moment, but we're gonna kind of be family for a minute. Right? Yes, we can do this. Y'all gonna make me feel comfortable telling y'all this personal story, right? Yes, all right. So I had a medical procedure. I'm not gonna tell you what it was for, but it was nothing big. It was a small thing. And this is a true story. My team knows this, and they can attest to it if y'all think I'm making this up. This is true. I had a medical procedure, I don't know, maybe about a month ago, and I had to be put to sleep. And so anyone that has been put to sleep, you know that you can wake up and you may say or do interesting things. And so I was put under. I remember them asking me, Ms. Johnson, are you asleep? Are you feel sleepy yet? And I said no. But the next thing I remember was somebody saying, Ms. Johnson, it's over with. Are you awake? Can you hear us? And what I said, and this is on record, of about a room of 8, 9 nurses and doctors, I said, do you know what 988 is? I heard myself, and one of the nurses said, does she mean 911? Is she asking us to call 911? I, still fully medicated, said, no, I meant what I said, and do you know about 988? And they said no. It was an ENT type procedure, so ear, nose, throat. And one of the nurses had a cell phone in her hand. And I said, you should Google it. Google it right now. Google 988. She said, okay. The doctor says, I'm going to leave because clearly she has her cognitive abilities and I think she's good. Y'all can take it from here. So the nurse Googled 988, and I proceeded to say, shame on you for not knowing what 988 is, and you're a medical professional. She looked it up and she said, this is real. It is a real thing. And so I taught them something in a moment where I was not completely present, but apparently my cognitive abilities were still intact. So make sure if I can do that, that you leave here and you tell somebody you don't know about 988. That's my TMI story. And just talk about what SAMHSA is. Some people aren't familiar with SAMHSA, the organization, so I do want to take a little bit of time to talk about who we are, since you've heard me reference it many times today. Our core mission is to improve the behavioral health of our nation, which means better services and resources for individuals and their families who are facing mental health conditions and substance use disorders. Our mission is more than just a statement, it's a commitment. Clearly, if you're having a medical procedure and you wake up talking about your work, it is a commitment. We're committed to improving people's lives by promoting mental health, preventing suicides, and enabling the treatments and support that are needed for recovery. So we know the data. It's up here for you to see. I'm can't do a bunch of looking up there and looking back there, but you can see the data, and we know the need. We know we have data that supports what we're doing. We know that too many people are experiencing mental health crises without the support and the care that they need. They are counting on us to improve this system. Urgent realities drive this need for crisis service transformation across our country. Okay, I did do something. We're in a special moment right now in this country. A part of what we're driving towards, obviously, is 988 as being the catalyst. This 3-digit number, I was having a conversation with Darren, I don't know where he went, out in the hall, and we were talking about we're gonna not be around to really see the full fruition of what this will turn into. We're at the beginning parts of what is definitely a catalyst, and it will change the way this country provides behavioral health crisis services, and you can't have a conversation about behavioral health crisis systems and accessing those services without talking about what happens on the front end related to prevention, and then what happens when the crisis is over. The crisis does pass, and so what happens after that? Is the system equipped to help to be supportive of all those individuals? And so we're at the beginning. We know we have lots of work to do to meet this need that you see outlined here, but we're well on our way, and you can hear from everything that's happened today that no matter what corner we go to in this country, people are working hard to be a part of this transformation. It's going to take time, but as we get there, we are responding to these challenges to make sure that we continue to invest with federal funds to directly into the grants that I've heard talked about today, provide technical assistance to directly support the 988 Lifeline to states, to territories, tribes, so that you can address workforce challenges, so that you can hire the staff that you need. I saw all those teams of ones up here, so that you can help to get the full teams that you need in place, and then expand your capacity to be responsive to crisis services, therefore ultimately improving local crisis response. I got to meet a couple of folks throughout the day, and I met a couple of folks who are going to be doing like peer support. I say this wherever I go, that peer support is so important and should be woven into the fabric of everything we do. It's fundamental, right? When people have shared experiences, that is a way that you can connect. And you often can make connections in ways that other professionals cannot. And so peers are really important, and I was loving to see the investments being made in the state around peers. So let's talk a little bit about how the Lifeline works. The 988, when you dial, chat, call 988. So when you call, first let's say it's 3 kind of pillars to 988. So a place to call, so whether you call it, text it, or chat. So someone that can be responsive to that call. And then a response. So in the instances where an individual needs response where they are anywhere in their community, that may look like a mobile response, it could look like other things, but that infrastructure is in place. So we're looking at the whole continuum. So it's important when you dial 988 that if your needs are not met when you make that call, that the system has the ability to be responsive to meet you where you are, to help support you. And then, of course, a safe place to receive help if that is what is needed. So that is the full vision of what 988 is. So when you call 988, you get a couple of options that are built into the call when you call. So you're given a choice to either connect directly to the Veterans Crisis Line. We have a very strong partnership, SAMHSA and the VA, around their Veterans Crisis Line. So through 988, an individual that is a veteran can press 1 to be connected to the VCL. We also have the opportunity for individuals that speak Spanish and want to be connected to Spanish-speaking crisis counselors can do so, as well as LGBTQI subnetworks. Once connected to the call, then you have an opportunity again to hopefully get what you need, rather that's the support. that you heard Zach talk about in his testimony earlier today, or rather that's connection to resources or connection to a response. We're also continuing to grow and really look at how we're supporting youth and our young adults. I am a mom. I have 2 sons, Noah and Micah. They are young adults now, 21 and 18. I don't know if I love young adults as a mom right now. It's different from teenagers. It's something different. They're in this in-between space. But what I have done well with them is they understand what mental health wellness is. They understand how to express their feelings and emotions. And they are boys. They're Black boys who are not necessarily taught and told how to express themselves, how to use words, to know it's okay to say, I don't feel my best today. And it's not anything physical. It is the way right now my soul doesn't feel okay. And so we all have a responsibility to teach our young people how to express themselves and not particularly tell our young men, oh, you have to be tougher, you have to be stronger. We have to normalize these feelings because they come out in other ways. And the same thing to my girls, I have some bonus girls. We have to teach ourselves like how to make sure we love ourselves. I love the "you're beautiful" comment that the older lady, you said old lady, I'm gonna say the older woman said to you about you being beautiful and thinking like, gosh, I don't think anybody said that to me before. So I think it's a message in that for all of us in this space. Did I? I don't even want to go that fast. Okay. It's going faster than me. Okay. All right. So a part of what brought us here today and our team is that we've been going around 2 communities since the spring, leading up to the 1-year anniversary of 988. Obviously, you can see what we're trying to get from this. This is our last stop. So we saved the best for last, apparently. This has been an amazing day thus far. But we've gone all over to do exactly what we're doing now to see what is happening in communities. What can we do to make these services equitable? What can we make sure that we're doing to make sure they're efficient, culturally competent, and accessible? I don't know if y'all will get a copy of this deck, but these are just some pictures from our road show. And you can see we've been kind of all over the place. We'll update this and we'll put Oklahoma in it just before we wrap this up. All right. So as we think about the continuum, and I talked about this a little bit already, but I'll just re-emphasize, again, this cannot be just about the 3-digit number. While that is the catalyst, and it is what is important, we got to talk about what happens before that crisis and what's after. So we envision a nationwide crisis care system that will provide everyone experiencing a crisis that person to talk to, again, someone to respond, and a safe place to help. This is a huge transition for this country. It's an important step. What we're doing today helps us step by step to get there, but we understand we have a long way to go. Significant investments in 988 Lifeline capacity at the federal, state, tribal, and local levels have helped to ensure that the 988 Lifeline is able to respond to many more people in crisis. While this is an exciting time to reimagine, and that is what we're doing, we're reimagining how we provide crisis services across the country, the full vision of a transformed crisis care system with 988 at its core will take some time to be built. It won't happen overnight. It will take steps. It will take individual people coming together to make this dream be a reality. Transformation of this scale does take time. It is complicated, and there is more work that will be needed to continue strengthening the 988 Lifeline as we work to fully build out the other components of the crisis system. We'll continue to take the lead in this work as the federal agency as we look to make sure we maintain health of the lifeline, but also begin to do the long-term visioning around building out the full crisis continuum. So when we look at this slide, this is about transforming crisis together. I talked a little bit about this morning, about this being a big old group project. You heard some of that in the outreach panel that went before me talk about how they're partnering, how they're working together to pull all of these pieces together, taking pieces of grants here, partnerships here, collaborations there to build this. This is what it will take to truly transform crisis care across the country. It takes the voices and the expertise of everyone. It's not just in the behavioral health spaces, it's in the justice spaces, it's in other healthcare, it's in education, it's in religious institutions. It is everywhere that we need to come together to make sure that we build the right type of services that are informed by people who will need them or who families will. The 988 Lifeline ecosystem is a collaboration that will take place between emergency services, your ERs, your EDs. It is a collaboration with 911 and other PSAPs. All of these things need to come together to reach the goal that we ultimately want to achieve. So as we continue to think about, well, what does it take to build out this type of a system? What we know is that we want to be able to build more mobile crisis services. We want to be able to build crisis stabilization centers. These can look like different things in different communities. Mobile crisis can look like a clinician with a peer or a paraprofessional. It can look many different ways. The idea is that there is a way for communities to have the type of response that they need. Law enforcement still plays a part of this as well. And so what does that look like, and how do you partner to make sure that people are being diverted away from law enforcement that are just simply seeking support or in need of help for behavioral health services? So as we think about equity and access, I wanted to give you a few stats here. So we continue to increase support for priority populations, including specialized services for American Indians and Alaska Natives, other services that I've recognized earlier today as well as we continue to expand. We continue to look at ways in which we will be doing formal research and evaluation to make sure that what we think should be happening is happening and that we can be driven by data to be informed. So, oh, wait. I hate doing this at the same time. So there's a couple of things up here I wanted to just call out. You can see the amount of contacts. That says about 5 million. At this point, it's over 6 million contacts, a little over a year. So we know that the demand is there and the need is there, but it also reflects the amount of people who still yet don't know and have not contacted that could use this support. So again, the outreach, the communication, the education continues to be vital. And then you can just see some of the other milestones that we've been able to achieve collectively reflected here in terms of some of the data as we reflect on year one. So as we look at looking at equity in some of our priority populations, you'll see outlined up there a list of populations a group of populations that we have deemed, based upon the data of what priority areas that we need to focus on. And so you'll see here, obviously, the ones that I've referenced already today. But again, just recognizing that equity in itself is that everybody has the right to get the same access to the same services, regardless of all the other things that I referenced earlier. So here are some things that, again, we're really proud about expanding some of the access. We'll continue to do this. I'm not going to just reread the slides. We'll continue to work towards this and making sure that the priority populations that we have identified actually are being impacted and connected. Sorry, I wanted to get here. All right, let me catch up. Oh my God, I swear I'm not hitting this. All right. All right, so this is not, it won't move. I think that was a test to see how fast I could think on my feet. All right, I'm fast on my feet. All right, so this will not stop me. All right, so I wanted to kind of get here to this part of the presentation. Captain Harrod is here today. She is our director for the Office of Tribal Affairs and Policy Partners. She partners with tribal nations, which is why she's here today, helping coordinate all of the work that we'll be doing here this week around the country to better serve the behavioral health needs of the tribal nations. Our commitment to tribal nations is built on collaboration, partnership, and to find out what is needed and meet those needs, not to dictate what resources that you will receive. However, it's important that we understand there is no one-size-fits-all approach to supporting tribal mental health. The type and degree of collaboration between states and tribal nations varies based on the needs of each community. By partnering with tribal nations, we're working to expand the 988 Lifeline access for our tribal communities. Initiatives including establishing a crisis center academy for tribal grantees and increased funding through the 988 tribal response grants are some examples. This is an opportunity for us to come together to continue to learn and figure out what is it that we can do from a federal lens to be very good partners to you. So we'll continue to coordinate, we'll continue to listen, we'll continue to learn as we help to improve 988 Lifeline services across tribal nations. Our goals include improving these connections with contact centers within the tribal nations, addressing workforce shortages, reducing turnover, and increasing culturally sensitive resources for those that are experiencing a crisis. We're also working to address the unique challenges and needs of tribal nations by increasing behavioral health funding, working to decrease stigma associated with mental health issues, and increasing the quality of mental health services available to tribal members. So here's a resource here, and there is a QR code there. I don't know if you can get it from there, but hopefully you'll get a copy of these slides. So I wanted to let you know, make sure you were aware, there's the Tribal Training and Technical Assistance Center that provides, at SAMHSA, that provides tribal nations with tools for treating and preventing mental health issues and substance use disorders, preventing suicide, promoting mental health. The Tribal Technical and Training Assistance Center supports wellness in tribal nations by providing resources that honor tribal ways of life and culture, knowledge, skills, and resilience to create hope and healing. SAMHSA receives input from the Tribal TTA Center to help improve the implementation of the 988 Lifeline for tribal nations. Additionally, we just stood up within our 988 office another training and technical assistance center. So we're going to train and give you technical assistance. That's what we're going to do. But we got another one that we're very excited about from the 988 office, and that one is geared to provide similar support where we can host panels, webinars, other opportunities to learn what we're doing, what's working, what's being effective, and make sure that we have two-way communication from the community, from individuals, so that we can be informed as we are setting policy and making funding decisions. So we're excited about that. This is going to be super important as we continue to evolve and really just expand the scope of the work that we're doing. So kind of leave you in this space around outreach and communication. Oklahoma obviously has done an excellent job of taking the 988 logo and really branding it and making it be what they felt like was appropriate for the state here. And so one of the things that we know is important as we move forward, and I want you all to think about this as you continue to think about your communication and your outreach efforts, is just really understanding the importance of clear, coordinated messaging that is aligned with your partners and the community members, to let those in crisis know there is help available through the 988 Lifeline. We recognize that that may look different in communities, and so it should take on some of that community reflection. We need to ensure a clear understanding of what the 988 Lifeline is, and what happens when you call, text, or chat, and what happens after you reach out for care. One of the things, or one of the barriers that I hear when I talk to people who may not have never called 988 or tried to reach out to 988 is they're not sure what happens. Like, it's like a mystery. So when we're communicating with people, like really trying to be clear about what to expect, you kind of know what happens if you dial 911, right? You kind of know what to expect. We need to make sure we're being clear with people so that we can help establish the trust in the Lifeline. We've created materials that can be tailored to your specific audiences to help you reach out to your communities as you see fit. We're continually adding to these materials, ensuring our partners around the country can use them and, again, do exactly what Oklahoma has done, which is make it their own. And these are just some of the examples of the things that we've seen. There is a partner toolkit. I must have probably went back. I'm done playing with this, so I'll just tell you. There's a partner toolkit on our website that does include FAQs, so frequently asked questions about the 988 Lifeline, print materials, branded photos, and more. You can also pick up many of these resources from the 988 information table that we have right out to the right of this room. There are downloadables that you can print, you can share, you can pass them out in your community, et cetera. And use our FAQs. A lot of commonly asked questions are there, and it helps you frame how you outreach in your local communities. So, with that being said, I really just want to thank you all for your time today. You let me come up here twice. So I don't know if that's a good thing or a bad thing, but I'm honored to be here and just really appreciate the transparency and just the reflections that I've had an opportunity to hear from today. Thank you for welcoming us in your space and just being heroes in your community. So thank you all so much.
Right on. Thank you, Monica. Awesome. Great information. Thank you so much. Right on. Woo! All right. How are we doing out there? Good? A lot of information. There you go. Wave your hands in the air and wave it like you just don't care. All right, here we go. Wave in the air. Wave in the air. All right. Take a deep breath in. And then let out your coffee breath. Right? As we're kind of moving around, and feel free. I know this is a conference and we feel like we have to sit, but sometimes it's okay to get up. It's okay to move around. You can stay in the room because we're really interested in the information that is being shared. But feel free to get up, move around. Wiggle around, get that blood flowing. With that, we're going to keep it going, and we're going to have a break after this next panel discussion. So please, again, give your full attention as best as you can. If you need to get up and move around, that's good. Let's bring up these individuals for our panel discussion. Joshua DeBartolo. Joshua, come on up. Sheila Williams, come on up. Where are they at? Joshua. Where's Joshua? Oh, got caught slipping. All right. Andrea Holly, sorry if I'm saying that wrong. Andrea? Right there. Okay, good. Tony, come on up. Tony Stelter? Tony Stelter. Oh, they all know, all right? Oh, yeah, Tony. And Ronald Sims. Come on up. How about giving these panel discussioners a round of applause? Yes. Right on. Don't be shy. Don't be shy. And they will be discussing in this panel discussion how can 988 meet the needs of tribal communities, and they're going to take their take on how they feel that's going to happen, and they understand the assignment and what's going to be discussed here in this panel discussion. So with that, I'll move it to Joshua, and we'll kind of move down the line. Joshua, Sheila, Andrea, Tony, and Ronald, and Christina. All right. Anyway, anytime you're ready.
All right, we're going to go ahead and open it up for questions. So I know that we had a little bit of roundtable earlier, but first, again, my name is Josh DiBartolo. I serve as a senior manager of community integration at ODMHSAS. Excited to help moderate this. So we have Ron heading out into the audience right now to help answer some more questions. But Andrea's going to introduce herself before we start taking questions.
Hi, I'm Andrea Hawley. I'm the program manager for the 988 Tribal Response Grant with Choctaw Nation.
Hello, I'm Christina Sharp, the mental health specialist with Cheyenne Arapaho Nations.
Hello, I'm Sheila Williams. I was just with Southern Plains Tribal Health Board for the last 4.5 years and recently went full-time private practice and now have my own counseling and consulting business. I'm happy to be here and see familiar faces too.
She held the microphone. I'm Tony Stelter, again from Solari. I'm the Director of Contact Center Operations and Clinical Services here in Oklahoma.
And I'm Ron Sims, again with the Department of Mental Health and Substance Abuse. All right, so this is a question and answer period, so let's see some hands if you have a question, and we'll get this going.
I'll kind of get us started off. I think, so the purpose of this panel is how can 988 contribute to the tribes? And I think the tribes are already doing really, really great work and taking care of their communities and providing services and connecting. Oops. Hello? Okay, there it goes. But I think our job as 988, as far as I'm concerned, is getting people connected to you that want to be connected to you. So that's what I see my job is working with you and hand in hand as a partner, and you telling me what's going to work for your community and me working with that to get folks connected to you that reach out to us that might be part of your communities. And so that, to me, that's kind of how I see it, but I'll pass it down if anybody wants to add anything.
Hey, Tony, if you don't mind, I'll add real quick. A lot of questions that we get from the state perspective is there are different services available in different locations. There are different hours that services are available. And so we get a lot of questions of okay, well, what happens if, somebody calls at 3 o'clock in the morning and there's no tribal services available? Well, as Tony mentioned earlier, there's a state system of CCBHC, Certified Community Behavioral Health Clinics. One of the requirements for a CCBHC is they have 24/7 crisis line and urgent recovery centers. Hopefully, by the end of this year, we have an urgent recovery center in every county that has 20,000 or more citizens. So there's always a 24/7 crisis service available across the state. If a tribal member is transported to an urgent recovery center for stabilization, or even if they have to go into a crisis stabilization bed, their case manager and their clinic ingrained in tribal services if that's what they want to have happen. So we always give them the option, and then if that's what they want, then we will get them connected to their tribal services. So with that, I'll go back to that.
So I was going to add, the only thing that, kind of talking about where we started with this origin of helping connect any Oklahoman and getting connected to behavioral health services through the 988 call center, one of the things that we wanted to ensure through this process was helping people get connected to tribal behavioral health resources like what Tony was talking about. So Tony and I kind of came together and we actually developed a questionnaire, right? So Tony and I developed a questionnaire and we gave it out to different tribal nations here in Oklahoma. And one of the things that we talked about was, do you have a mobile crisis team? Do you have a warm line that calls can be referred to? What does your behavioral health treatment services look like? Is there a wait list? We wanted to ask and inquire all these different questions. And from that, the cool thing that we got, and Tony can talk about this as well, is a referral pathway from the Chickasaw Nation. So the Chickasaw Nation, and that's not a 988 tribal grantee, actually developed that plan, and I think a lot of the other tribes saw that plan and how it was developed and were like, hey, we can do something very similar within our nation. So one of the things I will say, though, that has happened is we've learned a lot about behavioral health services of other tribal nations because, at our CCBHCs, one of the things that we have is set aside appointments for behavioral health crisis and different things to get connected to outpatient services. But one of the things that, we've learned through this process is not everybody's system looks exactly the same. For instance, with one of the nations that we work with, their process is you have to go to your primary care physician. From your primary care physician, you get lab work. From your lab work, you then get referred to behavioral health. And then from behavioral health, you may get referred to a psychiatrist or something else. So learning about these other systems and learning the intricacy and what the referral process looks like, and then also telling what our crisis continuum care looks like has been one of the ways that we've been striving to help make the system work better together. And not just referrals, but actually getting outpatient services established and helping people get connected at the end of the day. So that's one way that Tony and I have worked together to kind of help build the system, and now that has led to the tribal nations building their own referral processes from the call center. So.
It's crickets out there. Everybody's full from lunch. So one of the things, just to kind of piggyback to provide a broader perspective, some of the meetings that we've had with Tony previously when I was at Southern Plains was we can't tell, they can't tell, let me try this again. All the collaborations we've had, it's you guys trying to learn what tribal communities need, what the needs are, what the resources are. But that has to go both ways. Those of us who serve tribal communities also have to tell Solari, DMH, and everyone else what your communities need because they don't know. And that's where often the gap is from all the 988 grantee meetings we've been on and all the 988 partnership meetings we've been on. We know that there's gaps. So to expand on the survey that we did at Southern Plains that Mary Kate was up here talking about, that gave us a lot of information and it helped us identify where those gaps and barriers are. So being able to do some of those community needs assessments in your own communities helped us inform Tony, hey, these are the needs, and then how can we come together to fill those needs? What are those gaps? And I just wanted to kind of give you, I wrote down some that I thought were really important and significant because these also represent your tribal citizens in your own communities. And one of them was, and here's just a few, 14% of the 328 respondents, and almost 70% were tribal citizens who responded, just to give you an idea, and over 50% lived in rural communities. So over 14% said that they were unsure where to go if they were in a mental health crisis. The good news is that 75% said they were very likely or likely to call 988 if they were in a mental health crisis. But 42% were unsure if their tribe provided transportation to a behavioral health clinic. And that's a lot. And that's representative of our entire state. We had tribal respondents from every tribe respond. Other barriers said 67% would not call 988 due to long wait lines, and I think sometimes it's just misinformation. 67% said that they fear judgment from others. 65% said that they lacked transportation, and 62% said that it was hard to ask for help. So that's not something like Solari and DMH can really help with. That's saying how can we create the conversation in our own tribal communities that we serve to normalize the conversation about what 988 is, what they offer, and what that workflow is, kind of like what Ron's talking about and what, Tony, you've been talking about from the time you call 988, kind of what's that process flow? That's one of the main questions I get when I'm doing suicide prevention across our state is what happens when I call 988? So that's why everyone up here and everyone here today is trying, those are the conversations we're trying to answer. And so it takes this partnership between Solari, between DMH, between all of us as grantees and even those who aren't, to be able to have the conversation and promote awareness, because people are asking. Those are large percentages of people who just don't understand enough about what 988 is. And 40% said, what accommodations, that was one of the things that we asked in the surveys, what accommodations would you need if you use 988 transportation? And they said, 40% said someone who understands their culture. 35% said someone to ride with me. 8% said they needed wheelchair accessibility. And 6% said someone who speaks my language. So again, that's that conversations that we're having with our own communities to see what they need in order to get access to care, in order to know what services their tribes offer. Because I think 40% is a large gap for tribal citizens not to know if they have a local behavioral health center. So how are we all kind of creating that conversation and cultivating the conversation about what 988 is? Why can I not speak today? My brain, I've been up since 2:30 this morning, y'all. Give me grace. But what 988 is, and then what other resources are offered, even non-tribal resources. So I just wanted to try to give a perspective about the needs and the gaps that we're seeing. It's why these conversations and these collaborations are so important with each other and with the state and with our call center. Because the questions are being asked from tribal citizens all over. And one of my questions is to you guys is, how are you including youth and young adults in the conversation about 988? And it's just kind of rhetorical but serious, because we know the suicide rates in our state are high. And so what conversations are you having with local school systems? You know, and I see 988 going everywhere in the school systems, and I think that's great. I counsel a lot of youth and young adults. That's kind of my area. And they all, every single client, I ask, do you know about 988? And I have those resources in my office, and now it's on my intake. And so they're wanting to ask the questions because they're calling it and they're using it. So I just want to say kudos to you guys for what you're doing, to Josh and your team, to everyone in here. When young people know and want to talk about mental health, they want to talk about what a crisis or suicide is, then that means we got to be able to meet them where they're at and meet them where their needs are.
What community needs have you guys seen and worked towards within the time frame that you guys have been within the program that other tribal nations in the room could potentially associate with or gain some knowledge from?
So the Cheyenne Arapaho tribe, we started with a mental health youth summit. So that was kind of our big event for the summer. During that, we did a survey to all the youth that participated and asked them like what kind of things that they need. And the biggest thing they needed was just somebody to come talk to them. Many of the schools are rural and they do not have counselors, let alone Native American counselors in their schools. So one of our biggest pushes is to try to get into as many schools as possible. As Zach said, we are in schools all the time. That's one of our biggest outreaches. So we ask the kids what kinds of topics they need help with, and a lot of it is how to ask for help, how to manage anxiety, how to manage depression. Vaping is also another one. We work with all of the prevention programs, which is Tradition Not Addiction, suicide prevention, and also health education. We also have started asking our tribal opioid response to come to the schools. They were not as welcomed as our programs were just because of their messaging, but they are able to come with us and share their stories, especially our peer specialist, of how they started using and abusing different substances and how they came out of it to help their people. So we bring in a lot of people that we know have a story to share, and not necessarily we want the kids not to use, but we also want to provide them with hope, because a lot of these kids are going home to parents that are using. So if we are telling them that if you used, there's nothing for you, you're a bad person, like they're going home and thinking that about their parents. So we try to give them hope for their parents, for their families. So, but we take all of that from what the kids say that they want. Then we also provide, we just did an elders mental health, so we provide that. The biggest thing that we saw was the self-care. So we've partnered with the Department of Administration to provide self-care opportunities for all of our employees and their families, and just try to meet wherever we see a need at. 988 and the prevention team is there to meet that need.
So we had started out, our big focus was the clinical aspect. We immediately, one of our first things that we did was establish the warm line with 988 so we could catch those tribal members calling 988. We also set up within our tribe, Can you hear me now? We also set up within our tribe a system where we could catch all of our tribal members that are coming out of inpatient to provide follow-up counseling until we can get them into the traditional behavioral health. We are also working on getting into schools, and that has been a process in and of itself, but we're getting there. The Cheyenne Arapaho tribe, they are our heroes. We went and visited them, was that last month? So we follow them on social media, and we look forward to learning from them. And I think that's what's so great about this collaboration with these tribal grantees is that we can learn from each other and help each other promote and educate and help our tribal members.
Any questions on outreaches, how we get into communities?
Hey, Josh, I know that a lot of the grantees had a lot of training projects around what they were going to do. Could you talk a little bit about the training that the different grantees are developing?
Well, projects, Ron, sorry.
The training?
Oh, the training, yeah. So, yeah, definitely. So just to let everybody know, at ODMH SAS, we have a monthly meeting where we have a tribal 988 meeting, and then we have a regular ODMH SAS tribal behavioral health meeting. So they're two different meetings. And out of that meeting, there's been an organic work group that's come out of it. Are you guys a part of the work group? I know that Jennifer McLaughlin oversees the training component of it, and I've seen the work group focused away. You guys have different segments you guys are working on and different things, but I'll let them talk about the work group and their aspects of it.
So we are all working together with that have this grant to develop a cultural training for the Solari group. Tony has been working with us as far as what's going to best fit his team and what's going to best work for us in order to communicate cultural needs. Tiffany, you're the one that's kind of gathering all the information and making sure it gets to where it goes, and Josh, are you the one that's going to help us get it? I don't know where we're going to go from there.
So what we're doing is they're gathering all the information, and then we're going to put it on our training platform. And it's not just going to be for Solari. The idea is for the whole crisis continuum of care to be more, I don't want to say have cultural competency, because, you know, it's, to me, cultural competency is this unicorn that you're never going to achieve at the end of the day. So having cultural humility and understanding, as you have folks who are on the call center, mobile crisis teams, outpatient, this is something that can extend to all these different realms of the behavioral health system. So then ideally what's going to be developed by the tribal nations and the tribal 988 grantees in Southern Plains is making something that's a finished product for the whole crisis continuum of care to utilize and operate, and have many different approaches to get into the hands of outpatient, inpatient clinicians across the spectrum as well.
Josh does a good job, I think, of always advocating this, and it's helped me so much too, is reminding me sometimes, I think, as like we want to simplify things, so we want to group, like sometimes I think at a state level or at a Solari level or at a federal level, we want to group the tribes just all together, but we have to always remember, and we're collaborating, we're coming together, but each tribe is so unique in what they're offering and has different resources, and so it's not just, I can't just say I'm going to work with the tribes. I'm going to work with each and every tribe. You know what I mean? So I think that's where it's at, is having those conversations and talking with each tribe and seeing what the needs are and taking those needs and seeing what we can do on our end of it. So I just want to, he always points that out. Like sometimes I'll forget. He's like, Tony, it's like, it's each tribe. You can't lump them. And I'm like, thank you, sir. So.
I was going to add, part of that is building relationships, driving across the state, going and sitting with people, not having Zoom meetings, because I feel like Zoom meetings are super personable right now, right? We got used to it during the pandemic, but driving out to folks and having those in-person meetings. I've been out to Tallahena to meet Shauna, and I went out to China Rapo recently and got to go tour their buffalo herd. I actually went out with Rosie and some of the team over there, Katie Williams and them, and I actually walked out on them and didn't pay my tab, so they really tease me every time I see them. So I did pay them back, okay? I had another meeting, so that I had a good excuse. So all I say is you got to build relationships. In Indian country, I think too many times we always lead with the asking and wanting to work with tribal nations, but we haven't built the relationship yet. So I'm going to leave you guys with this. Remember this when you're working with tribal nations. Back that ask up. That's a K. So thought that would land a little bit better. Didn't. All right, here we go. We're going to move on. Ron, next question.
Back that ask up. Okay. Hey, Josh, how can tribal members become more engaged in this process and help with the development of materials and training opportunities and marketing opportunities?
Yeah, so one of the things I would say is, like everybody's been talking about, everybody's doing it a little bit different. Cheyenne Arapaho tribe, you guys don't technically have behavioral health services. Choctaw Nation has behavioral health services. So what does it look like for your tribal nation, but not just your tribal nation, but your tribal community? And then focusing on aspects you can engage, I think is really big. But it could really be as simple as just sharing on Facebook or social media, hey, there's a 90-day event coming up. And the one thing I want to mention, too, is it's not just focused on one generation of people, young people. This is a multi-generational approach to helping everybody. One of the things I think that we forget about is geriatric individuals. And, they're still impacted by their mental health at the end of the day. And being cognizant of these folks that may be isolated because of, chronic diseases or illness and things like that. I think being aware that, our messaging has to be multi-generational. And for tribal communities, growing up in my tribal community, hanging out with my great-grandmother was a very common thing to do. And, in our tribal communities, people don't go to nursing homes. They stay within the family. So kind of having that multi-generational approach and aspect of it as well, I think is really huge. And getting to know what your community looks like. Because just because I'm Comanche from Southwest Oklahoma doesn't mean I know anything about Modoc Nation up there in Northeast Oklahoma. So having cultural humility even when you are maybe a tribal citizen yourself. So.
All right, well, we really appreciate you guys paying attention to us again today. Are there any last questions? Okay, we got some over here.
Hi, so you guys mentioned earlier throughout some of the beginning presentations about Native and Strong located in Washington. Have you guys ever considered echoing the program here, knowing that we have twice as many Native Americans as they do? I think we have a broader audience, and I'm kind of curious to see if that's a possibility for our future 988.
So I think one of the biggest things, like Tony was saying earlier, is every nation is different in Oklahoma. And I think having and reinforcing that tribal sovereignty and really having an understanding of what tribal sovereignty looks like is one thing. And, so I actually have talked with Raquel from Native Strong Lifeline, and we have a great relationship. We actually shared our marketing from Oklahoma with them, and they've wanted to have something very similar out there as well. But we have our monthly meeting, like I was mentioning earlier, with the Tribal Behavioral Health, and Raquel's going to be joining us for one of our future meetings in the near future to talk with the different grantees about what they're doing and seeing if that's something that could be an option here in Oklahoma in the future. So, yeah, always looking for innovative ideas and helping getting them connected to the nations.
So I'm not gonna give it too much information just to make sure it stays super private, but like one thing I think that's really amazing about the tribes is that, and that what I'm hearing too from these groups that got the grants and other groups that didn't get the grants too, is like the integration into the community and how important that is, because yes, we're building some pathways directly to tribes, but also sometimes that's not the only pathway that needs to happen. So an example is, this is actually a true story. Somebody reached out to us through the chat or text function through that medium, and it was a student, so it was a youth, and they had expressed, they had suicidal ideation with a plan and an intent and a means. We were able to get enough information from that person in order to let the school know what was going on, because at that point it was an imminent risk, and that school was able to connect with the tribe. It was able wrap services around that kid, and that youth did express that because they were out and were connected, that did save their life. So that's why it's not just us having a partnership with tribes, but it's the tribes having partnerships with the community and having different pathways, because that's so important. Like, the crises don't just happen, where they call every time. Sometimes they might have it at school, and so having a way to get them connected to the crisis services through the tribe, through the school, or whatever pathway it is, that's just a perfect example of it, and I just love that story too. Any other last-minute questions?
So I'll repeat the question. I'm going to summarize it a little bit. I'll try. So his question was, when you are going out into the communities, are you doing some kind of empowerment? So not necessarily just talking about mental health crisis and suicide prevention, but also giving them the tools to feel empowered enough to ask for help or to take control of their lives. So I feel like Cheyenne Arapaho Tribes does this really well. When we go out to communities, we always try to bring some kind of event. As Zach said, we never go into a community without bringing something, whether it's food. I mean, we try to always bring food. But we have a mobile medical unit that we utilize in collaboration with our IHS. So we use that mobile medical unit twice a month for just basic medical services, but we also try to utilize it for mental health services as well. So I provide screenings and everything during that time. But on the inside of our community centers, we have some kind of community building. So our biggest thing is community, trying to bring multiple people together, to bring people back into culture. We use Singo to promote music therapy. We have done different kinds of art to try to bring art therapy. We collaborate with our language and culture program and our Department of Education to provide different kind of cultural resources. We also have our cultural advisors that we use. So we try to give them as many options as possible, because we know that somebody might experience anxiety different than somebody else, or depression different. So we try to promote as many coping skills, resources, anything to meet people where they're at and what is going to help them the most.
I'm gonna get my peer support piece in here too. Like what Zach just did earlier is a good example of empowering too, being willing to share your story of how you're willing to reach out when you need help. That's empowering in itself. So people being vulnerable and talking about it, that beats down that stigma that prevents us from doing that. So brave people like Zach sharing their story and going to places, that's a big part of it too.
All right, thank you guys. Appreciate it.
Good job. Bring it in. Yeah, bring it up. Yeah, good job. Right on. Woo. Hello, check, 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 check. Microphone check. Which one was dying here? Hello, check. We will fight. Up. Hey, I'm just joking. All right, how's everybody doing out there? You good? That was very informative, and I know a lot of us still had a lot of questions left as well. And but obviously reach out, ask for additional questions. Don't be shy. Back that ask up is a new one. I was like, what? Oh, shoot. For now, I think we are going to take an early break, but we're going to come back earlier, and we're going to see what goes on. But first and foremost, again, there is a lot of information. There is a lot of, make sure either you're writing it down or you're retaining it some way, somehow. Ask for those particular people that were speaking for their contacts. And let's kind of come back together, take a deep breath in. And then now, another deep breath in. And then let it out. Okay? And wow, you guys are cray. I am tired. You can't hear me? I am worthy. Okay, I'm just okay. On a count of three, say. On a count of three, say, I am worthy. 1, 2, 3. I am healthy. I am love. And a really big, I love you. On the count of three. 1, 2, 3. All right, go for your break. Go get some movement. Go get some coffee or whatever. You come back at 3:10. 3:10. 3:10.